take them.
You are settled and we can take off now. Before we start, we need God in our midst. So I'm going to call on Mrs. Odum to give us a word of prayer.
Please shall we bow our heads. Father, in the name of Jesus, we thank you for today. We thank you for the lives of everyone gathered here, especially the brain behind this meeting. We pray, committing into your hands that you reign. At the end of it, the intent of this meeting will be achieved. We will leave here satisfied, doing better in our various facilities and institutions, making Ghana proud and making you proud as well. In Jesus' name we pray. Amen.
Amen. Thank you so much, Mr. Sodium. Okay, so we want to take about just 5-10 minutes briefly to introduce ourselves real quick. I want to start with me. My name is Betty York from Hefra. So I'll take the mic and then we do that briefly.
My name is Lord Anthony Basing, Incas Diagnostics.
Okay, Robert Jagblete, University of Ghana Medical School.
John Kuto, Department of Biomedical Engineering, Lagos.
Sam Bird from the United States.
Lee Mikowski from Northeastern University.
Philip Bano, Hefra.
Fred McBagon-Lurie, Academic City University.
Honorable Tina Menz, Deputy Minister for Health.
Emmanuel Opoku-Yeboah, Academic City.
Vanessa, Ministry of Health.
Thelma Sari from the U.S.
LCFA Kaufman, School of Engineering Sciences, University of Ghana.
Ben Honyenuga, Ho Technical University.
Osabe Mawusu Bevia Boaji III, Achim Junase, Achim Obuyaka.
Barima Oponchichiku II, Chief of Achim Batebi.
Divine Nate, Chebi Government Hospital.
Francis Danso Ajari, 4GBI, USA.
Stephen Owusu, Hefra.
Morai Duamankwa, I'm a community pharmacist.
Jeremiah Soa, University of Ghana.
Gloria Megache, Medical Lab Sciences, University of Ghana.
Stephen Anan Arthur, Our Lady of Grace Hospital.
Charles Jedu, Our Lady of Grace Hospital.
Anastasia Pakosa, Our Lady of Grace Hospital.
Dr. Nanesi Geize, Ifyankwanta Regional Hospital.
Yvonne Conquest, I say, Whole Technical University.
Grace Naya, midwife, Our Lady of Grace Hospital.
Janet Eduse Bane, Shayo Sudoku District Hospital.
Fiagbeji Lydia, English Manful Polyclinic.
Saada Sadiq, Senior Nurse Manager, Kolebu Teaching Hospital.
Matabuajo Ajumo, University of Ghana student.
Catherine Hayford, Mamprobi Hospital.
Benjamin Myers, University of Ghana.
Salasi Bedevi, University of Ghana.
Sarana Hefra.
Mariam Asamoah Hefra. Jacqueline Treme Hefra.
Evelyn Sam Hefra. Lillian Kunedu, retired midwife.
Pakwiki Asamoah Ayelo.
Kwesi Jabba Hefra.
Bennett Kobia Hefra.
Amenohu Elinam Hefra.
Felix Bogu Hefra.
Vincent Hatu Hefra.
George Johnson, Gene Lab.
Gertrude Kudu, University of Ghana.
Ame Suman, Wagbeb, University of Ghana.
Robert Hammond Hefra.
Francis Ano, Hefra.
Majid Al Hassan, Hefra.
Bernard Ejay Quenin Hefra.
John Achukluvia Hefra.
Phyllis Bisaba, Hefra.
Emmanuel Amte, University of Ghana.
Annette Moa Hefra.
Abna Ingman, Academic City.
Linda Ampa, Accra.
Anani Asari, Junasi.
Betty George, Achim Batebi.
Kwajo Buedu, Achim Batebi.
Ekia Buedu, Weja Bawe Municipal Hospital.
Janet Brimpoma Odum, Amamole Health Center, God North. Thank you.
Okay, thank you so much. Once again, welcome. I believe we all know the purpose of this symposium. The Biomedical Innovation Symposium is to forge partnership across health, academic, business, government sectors to work together to improve the delivery of healthcare service. Without much ado, I want to welcome Osaberima Owusu Beifi Abuaji III, Chief of Achim Junase, to give us the welcome address. Thank you. Let's welcome him with a clap offering.
Good morning. I hope your journey here was a reasonable one. And I say reasonable because when you debate, you can argue whichever way. I'm sure most of you are wondering why is a chief standing here to talk to engineers and doctors and health professionals. Yes, chief, we are often in the first line of point of contact in our communities. If any issues happens, they come to the palace. There's accident, whatever it may be, if someone needs anything, they come. But the most important thing is that we are all agents of change. So it's a pleasure and honor to be here. Ladies and gentlemen, I'm highly elated to this honor to welcome you to this Ghana Biomedical Innovation Summit. The intent of this summit is to create a dialogue with health professionals, academics, engineers, entrepreneurs to understand the type of resources that are needed in various health facilities and develop a reasonable course of action. This summit is designed for us to listen, learn, and forge a partnership with your organizations or entities. The essence is to forge communication and gain valuable information with regards to health, resource, establish partnership, collaborate with your organization to build resource capacity to enhance healthcare delivery within various geographic areas, which would improve quality of life equitably. We are aware of some of the challenges that some of the health centers, clinics, and various health institutions may be going through, but we want to hear from you, the practitioners and the professionals. You know what actions to take to improve healthcare delivery. You exhibit greater power to influence public policy and advocacy efforts in public health. In light of this, it is a great opportunity to develop strong cross-sector collaborations to enhance healthcare delivery that produces healthy and equitable benefits. Bioinnovation in healthcare delivery values your participation and your partnership to drive change at the intersection of public health. We will listen to your ideas, suggestions, and your questions to enable us to plan a reasonable course of action. I'm therefore happy to be part of this interaction, and I look forward to a successful summit. On a personal note, I want to recognize the members of the 4GBI for Ghana Biomedical Innovation. For almost 6 months, we've been on Zooms. Some of us just saw each other. I didn't realize how tall and strong and big President of the academic city, Fred McBanori, is. And we all happy to be here. Professor Lee Makarski on Monday toured most of the health facilities in the Chimobuakwa. My own sister and friend, everything, who has helped me dearly, Dr. Thelma Sari. And she also managed me, and I'm sure after I exit the stage, she's going to let me know about a few critiques. Sam Bird, the Californian gentleman, engineer and inventor himself, he traveled here from California. Took him 17 hours to get to Ghana on Saturday. We took him to the villages. He even drank palm wine. You know, Dr. Philip Banner, my good friend, the head of HEFRA, has been very instrumental in this effort. Dr. Elsie Kaufman, I met her at the Ghana Biomedical in September. And I hadn't seen her, but Professor Lee Makarski has mentioned so much. And I saw her, and she saw me in my robe and my slippers. And as a chief, I ran to her. She's an engineer. And she said, "Oh, this is wonderful. I'll make sure I'm here." And Madam Health Minister, as I was saying, you know, Boston University, where I've been teaching for the last 22 years, my students often ask me about are women involved in high offices in Ghana? And I always do the best to answer those questions without getting myself into trouble, whichever way you slice and dice it. You are a role model, not just for a little girl in Junase or in Accra or in secondary school, but globally. And so it's a pleasure to be in an audience with you. Thank you very much for having me, and I look forward for interaction.
Thank you so much, Nana, as we traditionally call him. Okay, so you heard him. They are here for your suggestions, your comments, and whatever you think you can do. And I like the word he used, change. We need change. And so if you have any idea, any suggestions, don't hold it to yourself. Feel free. This is a symposium. Ask questions. Write them down. Don't forget. Write them down and ask all of them. That's why they are here for you. Okay, so we now want to welcome Mr. Lee Markowski. He's the chair of the Bioengineering, Northeastern University, Boston. Please, let's welcome him with a clap for him.
I think the chief has already said everything I meant to say. As you just heard, my name's Lee Makowski, chair of bioengineering at Northeastern University. This is my third trip to Ghana, and it's been an astonishing trip. I want to thank the many, many people who have contributed to my visits here and to this conference today, and the workshop that we held in JB on Tuesday. I want to give particular thanks to the minister. Excuse me. I want to give particular thanks to the minister for coming and contributing to this, this event. It's so important to hear your views and to help you listen to the views that we're going to be shared with us today. Thank you. The purpose of this meeting, as has already been said, is to begin the process of forging partnerships that might lead to major efforts long-term to improve healthcare delivery in Ghana. One of the reasons for doing this is that in my visits to Ghana, I have seen a huge opportunity. I've interacted with the students and faculty and healthcare workers and seen an energy and a passion for improving healthcare that I've been very impressed with. I've visited rural healthcare clinics 2.5 years ago, and then again this past Monday, and I've seen the resources that are there and talked with healthcare workers to understand better the resources that could improve the delivery of healthcare in Ghana. We believe one way to go to get an improvement in healthcare delivery is to develop instruments and supplies here in Ghana. One of the things we learned in the pandemic, one of the things I learned in the pandemic was the word supply chain, which I'd never paid attention to before. But what we learned was that supply chains are long and fragile and can break easily. And when they break, you can suddenly have shortages of perhaps essential supplies or instrumentation. That's very important for Ghana because 95% or more of the medical supplies and instruments that are used by the healthcare facilities in Ghana come from abroad. 95%. Almost none are produced here. And that has some real negatives in terms of healthcare delivery. First, of course, the obvious one is that supplies are vulnerable to disruption. And in healthcare, that can be life-threatening. Second is the expertise for maintenance and repair of the instruments that you have, maybe in Europe or North America or Asia. And so getting that expertise here to help in the repair and maintenance of instruments is extremely difficult and very expensive, and spare parts are often very difficult to get to, take a long time to get here, and are very expensive. But the other thing which is interesting and maybe not quite so obvious is that when you purchase instruments or supplies from Europe or North America, Asia perhaps, they aren't really designed for the environment that exists here in Ghana. They're designed for an air-conditioned facility in Germany or the United States. And that can make a difference. Let me give you an example. Blood pressure cuff. Really simple, okay? Blood pressure cuff, you put it around your arm, you push a few things, and it's got plastic tubing which is connected to metal grommets. And when you're taking blood pressure at 30 degrees centigrade, that plastic breaks down much faster than when you're taking blood pressure at 20 degrees centigrade. If you were to develop a blood pressure cuff where the plastics are designed to be used at a much higher temperature, you could end up with a blood pressure cuff with a much longer lifespan than the ones that you might purchase from Europe or North America. Simple, and yet it really makes a difference. The advantages of developing a biomedical device industry in Ghana are quite substantial. First, you can take advantage of a quite considerable pool of talented engineers and healthcare workers that are really, especially in engineering, very underutilized. I've talked to students who clearly are getting an excellent education here, and they finish up their degree and have great struggles finding jobs that would utilize their training and allow them to make a difference. They're passionate. They want to make a difference. I've talked to them, and they want to form a company. They want to start something that would make a difference, and I think it would be great if we could help them do that. If the industry is formed here, it can utilize local materials. It can utilize sourcing things that start here. And that can make the instruments or supplies that you develop much cheaper. It also has the advantage that you won't be exporting currency to some other country. And you'll have a lot of opportunity to improve the local economy by doing this work here. The other thing, of course, is that if you've got an industry here, you can work with healthcare workers here to optimize the designs, not for Europe, but for the environments that exist here. And whether that involves instruments that you can use at much higher temperatures, or instruments that are resilient to dust, resilient to variability in the electric supply, all of these are things that can be integrated into design that wouldn't be thought of if the design was being made somewhere else. Finally, of course, if you're building the instruments here, you will have local expertise for maintenance of the instruments, for training of healthcare workers on how to utilize it, for repairing, and of course the availability of spare parts will be much, much more convenient than if they had to be shipped halfway around the world. I think there's a huge opportunity here, and that's one of the reasons that I'm here. 2.5 years ago, I was in Ghana literally at the start of the pandemic. I got back to Boston, I think, on the 9th or 10th of March. And on the 13th of March, they closed Northeastern University and sent all of our students home to finish the semester remotely. A few days after I returned to Boston, I got a phone call from a businessman that I had met with when I was in Accra the previous week, and he said, Ghana needs ventilators. There are probably less than 200 ventilators in this country, and we don't know how many are actually functional, but Ghana needs ventilators if we're to survive this pandemic. And I didn't know how to procure ventilators for him, but I thought it was a great idea, and I tried. And it turns out that every ventilator on Earth had already been purchased. And every ventilator on Earth that was going to be built in the next year had already been purchased. And so obviously we had to find an innovative solution to the problem. So I went to Craig Smallwood, who was a respiratory specialist at Children's Hospital in Boston. Craig had gotten his PhD at Northeastern, and I knew him slightly. And I said, Craig, we need to have a way of providing respiratory support for people in respiratory distress in Ghana. And Craig jumped on the problem. He absolutely went for it with a passion that was incredible. And over the course of a month, he developed a very simple design that would be possible to help perhaps 80% of the patients who would normally need a ventilator. And the amazing thing about the design is instead of costing $20,000 like a ventilator, the design would cost maybe $20. Wouldn't use electricity, and would be very easy to use with non-physician healthcare workers. Craig put together 5 of them, and we shipped them off to Corlebu for testing, which Robert Gigliotti was able to do. And while those 5 ventilators were originally in process, Craig Smallwood died suddenly. It was shocking to me. He'd spent the last month of his life working day and night to put this together, and for no apparent reason, passed away. 35 years old, 2 kids. It's just tragic. And I got angry. I got angry, and I said, we are going to try and find a way to put in place the vision that Craig had. We got another 20 of his devices made. Fred McBacken-Lurie at Academic City made a bunch of them, and we put them out in some of the rural health clinics. 20 is just a drop in the bucket, a scratch on the surface. But it was a start. In talking to some of the midwives and nurses that have used them last Monday, I realized that they really have helped a few patients along the way. And I think it's an example of how innovation can come up with solutions that would not normally be thought of in multinational corporations from Europe or Asia or North America, but innovative solutions that could be originated here and put in place here with the guidance of the healthcare workers here. What I do know is that in order to fulfill this vision that Craig Smallwood had, we're going to have partnerships between healthcare workers who know what has to get done, engineers who might figure out how to do it in particularly innovative ways, and businessmen who might help the engineers and healthcare workers form companies that would allow production at a level that us poor academics would never aspire to. I hope today will be one small step forward in fulfilling this vision. I am really excited to be here. I am delighted that all of you are here. I'm looking forward, as the Chief has said, to hearing your ideas and your thoughts. Minister, I'm delighted that you're going to be here and looking forward to talking to you as the day goes on. Thank you very much.
Wow. I don't know about you, but I'm so happy. As he was speaking, I realized that God, in fact, is listening to the cry of lots of people in Ghana. We need innovation. And we want to get to the stage whereby when one is sick, you don't have to think of flying the person abroad just to get health care. We need to improve our health care system. Well, without much ado, we are privileged, in fact, very privileged, to have in our midst our own Deputy Minister for Health to give us an opening address. Let's welcome him, please. Sorry, let's welcome him.
Thank you very much, Madam MC. And I say good morning to us all. Before I start, let me also thank Nana Osaberima, Owusu-Befi Abaji, the third, for the nice compliments showered on me and that of women. We want to assure you that we will definitely get there. We are coming gradually. And then we will accept when we are climbing, when we are getting there, there is always an add up to our names. If you don't add that name for you being strong, then you cannot get there. And so we dance to that strong. So we'll get there gradually. Nana Osaberima Owusu-Befi Abaji the third, Robert Diaglete, University of Ghana, Nana Berima Owusu Opon Checheku the second, Medical School, Dr. Filibano, Registrar IFRA, Prof. Lee Makowski, Chair about Bioengineering, Northeastern University, Boston, Francis Danso Ajari, 4GBI, Dr. Thelma Sari, 4GBI, Prof. Fred Mabagu, oh my God, Magbagori, really, yes. Sorry for the Academic City, Pascalinde, Academic City, Emmanuel Opoku Yeboah, Academic City, Prof. LC Efa Hoffman, University of Ghana. I am delighted to extend a warm welcome to you at this maiden Biomedical Innovation Symposium of the 4GBI mission in Ghana. The Ministry of Health and its agencies are very eager to participate in this program. You all represent a variety of professions, interest groups, and user experiences for biomedical devices. Given the complexity of the task our nation faces, this diversity is essential. The biomedical devices business not only manufactures high-tech, expensive diagnostic and treatment tools, but it is also creates the essential supplies and equipment required to run any healthcare center on a daily basis globally. They also provide us a highly competitive, diverse environment with constant technological innovation. There is a lot of potential in the biomedical device sector. The biomedical device sector holds immense potential in varieties of areas, some common and some unique. The delivery of healthcare requires the use of biomedical technologies. These are used in patient rehabilitation as well as in the diagnosis, prevention, and treatment of disease and illness. We know that having the correct biomedical device is essential in the domain of care delivery. So is the field of medical device needs that deserve its own distinct agenda. We are here together to help set the agenda to forge partnership across the healthcare industry, the academia, where the professionals are trained, the business development of these devices, government regulation, and enabling environment to work together to improve the acquisition and use of medical devices in their full range of application for the delivery of healthcare in Ghana. There are concerns about the adequacy of biomedical devices in Ghana, with less than 10 CT scans, about 6 MRI, 1 PET scan for a population of 40 million. Resources caused by investments in medical devices does not meet high priority needs and incompatible with existing infrastructures, irrationally or incorrectly used, or do not function effectively. This tells us some of the pitfalls. However, we are also here because of undisputable benefits of medical devices so inconsistently distributed. These medical devices produced for a medical market, largely focused on financially profitable diseases and almost exclusively designed for use in wealthy settings. Most medical equipment used in low-resource settings are imported from industrialized countries, and about 70% of the more complex devices do not function when they reach their destination. Coupled with the lack of technical expertise in maintenance, difficulties getting spare parts, and limited budget for maintenance and for purchasing consumables. Under these conditions, a technological miracle can rapidly become the world's nightmare for service providers, wasted resources, and risk to patient safety. In light of this sobering fact, we must consider what real cut-edge technology means for the developing world. Distinguished ladies and gentlemen, we now have another chance to pinpoint some related barriers that prevent biomedical technologies from being used to meet critical requirements in developing countries. The R&D agenda for medical devices won't automatically change to address unmet requirements in the poor world based solely on market forces, but biomedical devices need and deserve to have their own distinct agenda. I hope this symposium help us in this agenda. Thank you, and God bless us all.
Thank you so much, Madam. That was refreshing. We want to welcome Dr. Philip Bano of the Health Facility Regulatory Agency to give us the government point of view on all of this. Welcome, sir.
Thank you. Good morning, everyone. Good morning. Don't fall asleep on me, okay? The task ahead of us is daunting. I think, can't you just feel the weight of it? And it's the first of its kind that we are going to build it here in Ghana. And I'm thrilled beyond a measure to be here this morning. Deputy Minister for Health, Ms. Tina Mensah, and now Sabarima Usube Fiaboaji III, a man I've known for about 10, 15 years. Professor Lee Makowski, forgive me, is chair of biomedical engineering at Northeastern University in the USA. Mr. Sambulad is a business innovation resources all the way from California. Can you imagine that? Let's give a hand. Look at all the interesting places you could be, but you chose to come to Ghana and no other place than East Legon and in AH Hotel. We appreciate that effort and the thought for coming. Professor Mark Magunduri, Academic City, am I right? And all the invited dignitaries, I know I didn't mention everyone, I know some from Holt Technical University, some from University of Ghana, and many, many other places, and all of you from HEFRA, all of you are invited dignitaries and all invited guests. People from the media, ladies and gentlemen, I bring you greetings from HEFRA, and also to welcome you to this maiden conference, Ghana Biomedical Innovation Symposium. The regulatory framework requires that to effectively deliver quality healthcare, we need to ensure that we have qualified or trained personnel who are capable of using devices to give us the appropriate data so that clinicians can use that informed information to give us the best clinical judgment. We have qualified personnel, yes, but to have quality care requires quality data, which is obtained through the use of technology. When Professor Markowski was speaking, he was trying to make example of if you have a faulty blood pressure device, what you're going to get? A faulty reading, isn't it? And a faulty reading means that then a clinician will make what? Not the best decision for you. Suppose you have the oxygen sensor and it is reading wrong, because there's a big difference between when the oxygen is saying 92, which means you're okay, but it's 88, and it misreads it, then you are in trouble. You're having respiratory failure, but the device is not giving you the right reading. Imagine that you've been in the hospitals, you know, right? Those devices that deliver medication, the nurses hang them in certain amounts should come in within a certain minute or per hour. What if that device is doing it the wrong way? All of these things could spell disaster in the care of the patient. Now, this is what regulation is designed to address or to avoid. So, in Ghana, our government thought it wise to create a facility called, or to create an agency called Health Facilities Regulatory Agency. And our task is to ensure that all healthcare facilities have the standardized devices that will work in our environment. Again, we at HEFRA are to ensure that those who are using the devices have been trained and they know how to use it appropriately, how to maintain it, and how to make sure that it's not giving us a faulty reading. Our purpose this morning then is to build upon these observations so that when we have the Biomedical Innovation Center, it's capable of delivering devices that will address the technology resource gap we have in our country. Innovation is not easy. It requires resources, time, and efforts on everyone's part. Biomedical tools are now indispensable to the delivery of health care. But in our resource challenge setting, we need to find how low-tech alternatives can help us build upon what we already have, even as we reach for the latest technology. Biomedical technology has its promise, no doubt about that. They can give us quality data. They can give us information that we can't otherwise have. But then it has its own challenges. If it's not appropriately applied or used, it can fail at the time that we need it the most. The promise to deliver data that is needed for the patient at that moment cannot be forthcoming. And we know what that means, disaster. Technology, if it's not well built, cannot give us or guide us for the decision that we make. What we seek to build here is a more reliable technology that would deliver that quality care within our region. It is said that about 60 or 70% of the devices that we use, probably even more, somehow are not built for our environment. They fail often. But what was the purpose of doing this Biomedical Innovation Center? From the symposium, we hope to build a center. Is to make sure that when we build these devices, since they are going to be tested here, they're going to be piloted here, they will work within our resource here. Functionality is an issue because often there are three things that are not available or lacking. What are these three things? One, have we trained the people who are using it? I think I've said it before, but it bears repeating. So training Training is very, very important. But that is the first thing. We need to train the people so that they know how to use the device. And if you train them well, I actually believe that you will minimize how often the devices will break down. I hope you agree with me. The second thing, and those of you who are at HEFRA, and also those of you who are already in the healthcare facilities, you already know that, because we often find when we come and do our inspection and our monitoring to make sure that you are doing the right thing. We do not often have even maintenance schedules, right? Because we don't even know who is to do that maintenance. Am I saying too much here? I'm revealing too much, isn't it? But that is a requirement. If you are going to be in a hospital, I say hospital a lot, but it doesn't matter, it's a hospital, a clinic, wherever you are. If you are delivering care and you are relying on a device or equipment, after they've shown you how to use the machine and you are comfortable with using that device, ask them where is the maintenance log or other place to show where it's supposed to go. I went to a big hospital, I'll mention the name, and depending on who you ask, they'll give a different person who comes to service the ventilator. And I'm saying, hey, so engineer, who comes in here? This should not be a guesswork. I hope you understand what I'm trying to say. Who comes to service your ventilator? That's a life support for those who are not in the hospital. That should not be a guesswork, and I should not get two different answers. But it happens. So that is the second thing. Now the third thing is, where do you even get replacement parts? When the device is truly broken, when the sensor is truly not working. So these are the three things that I have identified, and these are the things the center will seek to address. There are some, so as we move forward, the challenge is clear, and they are daunting. But one thing I've also known is that challenges can bring you or can present opportunities for us to solve. If we solve this here in Ghana, others even in our sub-region will come to us seeking solutions to the similar problems that they are having. I'm sure their experience is not any different from us. But if we build this center and build it well, we give all these devices here, we pilot them here, and we know they are going to work, we will have the right people. Most likely we have the replacement parts. We will tell them how to, what is the maintenance schedule should be, and then we have solved the problems for good. I believe we can rise to that occasion, and that moment is probably now. Let us all together build a center that is capable of meeting our needs and solve this technology gap. Going forward, let us harness the potential from academia, business, all of you in the healthcare delivery arena, and yes, Ms. Tida Mensah and myself, who are in government, will provide that regulatory framework for you as oversight requires. Let us build the right technology for quality care for all, in Ghana, in Africa, and beyond. I thank you for your audience and your attention. Let's go. Let's get it done.
Oh, I think Dr. Bano has said it all. We have challenges. And in the midst of the challenges, you said you can have solutions. Yes. So let's admit we have challenges. I think we've been missing one important person too in our midst, in the person of Professor Ben Honinuga. He'll be speaking to us very soon. Prof, we acknowledge your presence. And before he comes, I want to invite Robert Jagbate from the thank you. I'm not a medical person. Anesthesiologist of Kolebu Teaching Hospital. I knew I was going to find it difficult to mention this, but sir, you are welcome, and he will be speaking to us. Thank you very much.
Thank you very much. It's always a tongue twister, anesthesiology. Okay, so I would like to look at it from the end user's point of view. Okay, so it's not moving. Okay, so the outline is this. We'll look at what medical devices are, look at their classification, and then we will go through the various medical devices, but specifically look at the challenges that we face as practitioners in using these medical devices. Okay, so technology in medicine has been used for several centuries. There are archival evidence that shows that medical or tools have been used in practice of medicine by several ancient civilizations. But we know that with the advancement in technology and then medical science, these tools have also been increased, and innovation has been developing. And over the past 100 years, there has been an exponential growth in the development of these medical devices. And today, the biomedical industry is worth billions of dollars. Okay. In the past, when somebody has a respiratory disease or some disease in the chest, the doctor used to put the ear against the person's chest to listen to the ear, to listen to the chest. Now, we've gone way past that. We all know stethoscopes were developed, but now we have more advanced imaging tools that virtually lets us see into the chest of the patient. So this is how far we've come. But medical devices is defined by the WHO as any article, an instrument, apparatus, a machine that is used in the prevention, diagnosis, treatment of illness or disease, or for detecting, measuring, restoring, correcting, modifying the structure or function of the body for some health purpose. The medical equipment is a subset of medical devices where these are electronic, where we need the biomedical engineers to really look at them. So I would focus on these biomedical devices. There are various classifications. The FDA, I'm sure in US and Ghana as well, uses classes 1, 2, 3, where they are looking at the risk it poses to the patients, class 1, low risk, and class 3, the highest of risk. In the EU, they look at it as non-invasive, invasive, and active, where non-invasive does not enter into the patient's orifice or any body cavity. And the active ones are ones that have closed-looped systems. But I'm not a biomedical engineer. I like to look at it at another classification. The WHO is seeking to standardize all these classifications and nomenclature. I prefer this one. I'm a clinician. Is it used for diagnosis or is it used for treatment? So in diagnosis, all the medical laboratory equipment, all the radio imaging equipment fall into this category. There are monitors that we use for various vital functions. There are things that we use for treatment, surgical, dental, instruments. I'm an anesthesiologist by training, so I cannot but mention of perioperative and critical care. And I dare say that in anesthesia and critical care, we by far use the most number and diversity of these medical devices. But we know that these devices do help us. Their value in healthcare, we cannot overemphasize it. But we know that in its selection, in the purchase, in the usage, they pose challenges to us. And it has been recognized that these challenges are even much more for us in the low and middle income countries. These equipment are supposed to help with our diagnosis and management and so on. But when they are not there, it's a problem. When it is there and it is not functioning, it's a problem. If it is there, it's not functioning well, it is also a problem. So wherever you pass, there's a problem. Okay, and we know that when these things occur, it has potentially grievous implications for our patients. We know in healthcare, we all do know that it's a very stressful industry to be in. Be it the doctors, nurses, I'm sure the biomedical engineers will also attest to it. It is stressful because we are on you. When we need the equipment to function, we need it now and here. So it's quite stressful. So when there are challenges, it just adds on to the stress of the already stressful business that we are in. But some of our challenges that we face, we feel it's because of the environment that we operate in. And we are in the tropics. And in the tropics, we have high temperature, we have high humidity. We know sometimes the area can be dusty during the Hamatan season. All the dust from the Sahara is blown to us. The effects on our equipment, when I sometimes go to the biomedical shop, then they open the equipment, say, wow, the dust, the little and things that are within this equipment. They open a ventilator that we use to blow air into the patient, you see what is inside the ventilator, then you really shiver. Yes. But these are the realities on the ground. This thing is not technical. Okay. So these are the realities that we face on the ground. It's our equipment that we have. Are they really adapted for our situation? Let to show, yes. Let to show that the next. If you are living in a well-resourced environment, and this is your road network that you travel with, yes, then of course you could buy a Ferrari, a Porsche, Lamborghini, fast cars. Then you enjoy it. However, if you are in a resource-limited environment, next picture. If you are in a resource-limited environment, like the picture on the left, where you have to go through a stream of mud to get to your destination in the middle of a forest, then you need to rethink. If you even need to get an ambulance, that ambulance must be made to be able to function within. So this is where we need to go. And I think we have the capacity to move. We have done it. We've done it before. And I think we can do it again. We have tractor ambulances that gets people out of these places to seek health care. And it is this same attitude that I wish we will adopt when it comes to our medical devices. So why should we go for Ferraris and Lamborghinis and Porsche biomedical equipment? Very expensive to maintain, getting the accessories. It's just too costly. The HEFRA is here, but I think there is some laxity in the enforcement. I know Ghana, when it comes to laws, we have the laws. I think in the whole world, we have most of the laws. Enforcement is our problem. I just went to our first floor theater, those who know Kolebu, the main surgical theater in Kolebu, just yesterday. I know the problem is there. Just yesterday in the afternoon, and I took these pictures. These are meant to be oxygen cylinders. I don't know what the color coding for our cylinders are in Ghana. This is the tertiary hospital, Kolebu. Quaternary Hospital, sorry. Center of Excellence. Black with white shoulders, white all over. This one, I really don't know what gas is in it. But this is what we are really faced with. We get equipment, and some of the anesthetic machines, they don't have audible alarm systems. When the gases, oxygen runs out, you just see some blinking lights on the machine. But this is where we don't have very reliable electricity and gas supply system. So they fail continually. I'm not bashing the system, but that is the reality on the ground. So we need to have the safety net. If the machines have alarms, they will alarm. But sometimes it may be too late. These are some of the problems we are facing. Power is not the best. These medical devices, I'm sure the biomedical engineers will tell you, they need stable current, pure sine wave. Okay, but we don't have that anywhere in this country. I sit in my office, my computer is attached to AVR, and you see the currents fluctuating. At best of times, I get 205, 206. Once a while, it goes to about 220 something, then you are okay. But you never have stable current. Sometimes it can shoot to 300. Yes. These are not good for our machines. They spoil the machines. And much worst of all, sometimes the machines don't go off, but can we then believe whatever values or results we are getting from the equipment? Because they are calibrated with the power in mind. Next slide. Yeah. So what part of our problem is that sometimes we bring these Ferraris and we manage to send them by helicopter or whatever means to the districts. As I think the head of HEFRA said, training. We send equipment to regions where the people are not trained to be able to handle the machines. I'm sure there are ABG machines and ventilators in some hospitals where they don't have the expertise to handle them. Meanwhile, other tertiary, quaternary hospitals are lacking them. So we need to look at the equitable distribution of these resources. Some of the equipment we purchase also they don't come with the complement, the requisite accessories. So you have ventilators that do come without humidifiers, which are essential components in the respiratory care. So the ventilators come, no humidifiers. You put them on the ventilator and patients on the ventilator, and you have several problems. I don't want to go into, but it impacts on healthcare and morbidity and mortality of our patients. This picture, these are fluid warmers. They are using warming fluid. I can tell you we have about 3 different types in Kolebu. They are functional. They are working. The equipment themselves are working. But then the consumables. This one needs this set to be slotted into this gap, and then we connect our IV fluids to it. This one, you need to slot this cartridge in there and connect the fluid to. The machines are working, but the consumables is $50. How many Ghanaians can afford this? So the machine is there, we can't use it because patients cannot buy it. These are our challenges. We have SpO2 probes. Some time back, the pulse oximeter probe, when you put it on the black man, it does not pick. When you put it on the Caucasian, it works. These are challenges that we face on the ground. Some of the cables are too short. Our theaters sometimes they are not purpose built. So it's a room and you have to change it into a theater. So the power supply is somewhere. That's where the anesthesia machine and monitors have to be. The theater table have to be somewhere else. If the connections are not long enough, poses a problem. So you see yourself as a provider having to go under cables just to move around within the theater environment. And it doesn't augur well for us. Next slide. Because this thing is. Can you change to the next slide? Okay, so we have some of these problems. As we said, there are poor maintenance. The previous, it's been said, the maintenance culture is near zero. We buy these equipment without service contracts. So the equipment are purchased. Most of the agents are just agents. They are buying and selling. So once the equipment has been handed over to the institution, that's the end of their business. When you contact them, they cannot help you very much. So we don't pay them for service contracts. So the equipment are brought 3 months, 4 months down the line. Something small gets defective and the whole equipment is shipped. So packed somewhere. How often do we calibrate our equipment? I'm sure the medical laboratory people are doing well, they calibrate. But then what about the other medical devices? There are devices that we use. How many, I'm sure there are some nurses, midwives around. How many of your figs have been sent for calibration? Ever? So can we believe the blood pressures that we are recording at our various institutions? These are things that we face. And higher order equipment need calibration, servicing regularly. We don't have enough biomedical engineers. I sit in Kolebu. Kolebu is a huge facility. We don't have more than 10 biomedical engineers. When there's a problem in ICU and you call biomedical, oh, I am at medical block, I've been called there. Meanwhile, a ventilator is defective and you have to take the patient off. You are manually ventilating the patient and you have to wait till when a biomedical engineer becomes available. We need a lot more biomedical engineers to support us. The biomedical engineers should also be resourced. They should be equipped. I talk to them and they don't have the requisite instruments to test and maintain our equipment. So they need to be resourced. I feel the end users are not also engaged that much when we are going to purchase these medical devices. I know ministry will say there is some engagement, but I am calling for a broader scope of the engagement. One typical example, I sit in Kolebu. Ultrasound machines are going to be bought for Department of Anesthesia, Emergency Medicine, and then Ops and Gynae. If you send an Ops and Gynae rep to such procurement or bidding this thing, or even you ask them to bring their specifications, they are going to give you specifications for an OBGYN ultrasound machine. It will not serve the purpose of somebody who wants to do an e-fast in the emergency room or in the ICU. It will not serve my purpose to do regional anesthesia. So we push money down the drain and the equipment will be sitting there not really fulfilling its true potential because we did not put in the correct specification. We did not engage the end users down to the detail. We can't sit in Accra and request for equipment for people in the districts. We need to go to them, understand their challenges, what exactly they need. Then we can tailor the specifications of those devices to their needs. I think we need to do more. All these problems, it ends up with what we call equipment graveyards. We have them in Kolebu. These are two, just in my department, two examples. This is in the theater space, this is in the ICU HDU space. Some of these equipment, you see, are defective, maybe something small. Some are functional, but they don't have the requisite accessories. But they are sitting, these are thousands. This alone is about $40,000. Yes, our ventilators, this is an ICU ventilator, $40,000, $60,000. But it's there, defective. It may be something small. That biomedical maybe are not resourced enough to be able to service it. This is the end result. Ghana, we like talking about problems without solutions. I feel we need to make sure that the equipment that we have are robust and are appropriate for our environment. We need to increase our end user engagement prior to the purchase of these equipment. We need to ensure that we go for equipment with low running costs. On the market, there are the Ferraris, but the Toyotas are there. They perform the same function. If you get a Hilux, it will get you to the villages, but Ferrari won't. So we need to really tailor ourselves when we are going for these equipment. We should buy the equipment with the requisite accessories so that it can be put to the use that we want it to be put to. We need to sign maintenance and service agreements with the people who are selling these equipment, and we need to resource our biomedical units within our facilities, both human resource and then all the logistics that they need to be able to support the healthcare system creditably. Finally, there is no better time for us to start looking inwards. If COVID didn't teach us anything, Russia-Ukraine war is not really adding to it, and our present economic situation is not telling us we need to start looking inward now. We should develop and build strong and active networks of all the stakeholders so that we can look at designing, producing, and developing biomedical devices within this country. In conclusion, we know that the technology in health is helpful. We can't do without it. We've come way beyond when we put our ears to patients' chests. We need technology. We need to ensure that these devices are suited for our environment and that they provide the solutions that we have. We have the capacity. We can do it. There is no better time than now. We produce all these things in Ghana. These are plastic items. These two are plastic items. If I tell you, I can bet you 99% of health facilities do not have these simple items. And if I tell you how life-saving these items are, you will be amazed. But we don't produce them. We don't have them in a lot of health facilities. During COVID, 90% of our patients, this is all they needed. Unfortunately, we didn't have a lot of them. Nasal prawns was the best you could give them. But they just needed some with reservoir bags. They are plastic items. We can produce them here. We need to, no, I think this is a previous one. So I think that last thing is that I feel during COVID, we were able to survive. We brought the Veronica bucket to the world. It was innovated here in Ghana. In COVID, we sent it a step further. We added all these. Everything here is manufactured in Ghana. This is a single one-stop hand sanitizing station built, developed in Ghana. Yes, we can. We took it further. We were using fabric for our face masks. An industry which was hitherto producing mattresses.
re-engineered, and now we are producing surgical face masks in this country. So together we can. Thank you very much.
Thank you so much, Mr. Jablate. I'm happy, but I'm sad. He brought out all the realities on the ground, and it's not even funny. I can't laugh, I can't smile. I'm sad. I don't know about you. It could be you needing a ventilator in an ICU, and it's not there, and just that could save your life. It's disheartening. I don't know about you, but I took 3 important things he said. He said, Mr. Anesthetist, I won't add a geologist because I can't pronounce it. He said, is our environment well equipped for, is our environment suitable for the equipment that they bring in? He also said, are people well trained? And then he's calling for the broader engagement of the end users. These are 3 important points that I put down. If we have all these things, I think our healthcare system will be well equipped and a lot of lives could be saved. This is why we are here today. You might have suggestions, you might have, I want to believe that the stakeholders are taking note of this, and this is going to be aired one way or the other. In fact, I'm going to ensure that this is aired so that our stakeholders will take notice of this. Ghana, we need our healthcare system to be well developed, to save lives. Thank you. Without much ado, I want to welcome, we need to go for a coffee break. It's past our coffee break time, but before we go, we want to welcome our professor, Mr. Ben Honinuga, who is the Vice Chancellor of Ho Technical University, to give us a brief speech. Thank you, sir.
Thank you very much. Nana, may I crave your indulgence to proceed on the already established protocol? Honorable Minister, we are happy to have you here. And I want to say that I'm excited to be here and to acknowledge Sister Linda Ampa of KAD Manufacturing, who linked me up to this program. And she's a very good friend and a partner as far as our university is concerned. I bring you greetings from the Ho Technical University. And as I indicated, I'm happy to be here and to be part of this important summit to discuss strategies and resources to implement transformational changes to our healthcare system in general. To all the earlier speakers, I think there's one thing that we all have in common. What do we do to change the narrative? And I must say that I stand on behalf of Ho Technical University and say that we are ready to partner and to be part of this change, because we need this change now than ever. As pointed out already, the global impact of COVID-19 led to a disruption in our health services delivery and introduction of new norms across all facets of our lives. But then we saw the innovations that came on board. I didn't know, in my lifetime, I didn't know that we could even produce ordinary sanitizers in Ghana here. The ones I've seen in the shops were all imported. I didn't know that we could produce our own face masks or nose masks. But my university participated in the national call when the surgical masks were not coming. We got a call from the office of the president. We produced masks in our own way that supported the healthcare delivery system. We produced sanitizers that supported that. And I believe that we should leverage on that to move our nation forward. Fortunately for us, we've been able to survive the COVID-19 to a large extent. I would say we have survived if you compare to other countries. We've been able in our own way. People went back to their villages to find even local solution, neem tree, whatever. All of those things, I believe we could leverage on that and move on. Because as a nation, we better act now or we get lost. From the academic point of view, we as a training institution have to also pick the pieces and see what we can do to develop the highly competent human resource or the human capital that would support this agenda to change the narrative. As already indicated, we need all sorts of biomedical engineers to support the health delivery system. In fact, the many hospitals that we have today, and we are building more, need biomedical engineers. In who, for example, we have the teaching hospital, and I can count the number of biomedical engineers or technicians that we have. Professor Kaufman is here. They started training these biomedical engineers since the early 2000s, but then they are not enough. With the coming of the technical universities, we are supposed to bridge the gap by producing the technical manpower that will be able to support these innovations. And it's important to state that we in Hu Technical University started some work on establishing a Center for Biomedical Engineering to be able to train biomedical engineers not only to service equipment that have been imported, but also to push them to be able to innovate our own local solutions. And Professor Kaufman and her colleagues have been supporting us to do this. And we are also working with some development agencies to be able to set up this center. So I'm here with one of the young engineers in the faculty, Yvonne. So the issue about the women, so I've brought a woman engineer here also. Yvonne, can you wave them? Thank you very much. So there is therefore the need to establish additional training facilities which will be well equipped to fill the ever-increasing gap in the training of more professionals in the field. The question that has been asked, if we can produce all the plastics, why can't we transform those plastics into saving lives? Must we wait till another Ukraine or some other war where the ships, the horn from the ships will not blow and the supplies will not come before we start making a decision to manufacture our local equipment? We need to give it a try. And my friend who have just spoken, you said we have even a lot of some of those equipment that have been abandoned in Kolibu and other places. Perhaps we need some of those equipment to be able to do reverse engineering so that we look at them, in spite of the criticism about reverse engineering, we look at them in Ghana here and be able to open them up and develop appropriate ones that will fit our environment. Because we need that to be able to move forward. And with the local products available, professionals will be capable of carrying out adequate training for medical personnel and other end users on how to effectively utilize and sustain these technological devices, and also to perform both preventive and corrective maintenance on the products. I'm saying that we as a technical university have to pick up the challenge and stop the lamentation about the things are not there. We are not able to have money. There's no money. So, but without money, you can still think. And the people that make these things, some of these are just junior high school students. Because I've always told my faculty that nobody stops you from innovating. You can innovate in your bedroom. You can come out with an idea, bring it out. And when you bring it out, then we can now together seek support to see how we can scale up that innovation, that product that you are bringing on board. And so we feel that we need to fill the gap and also to make sure that we are able to develop the human capital that will support this agenda. On this note, I wish to pledge my support to the summit and to all that has been said today regarding the need to look inward. There is a need for us to look inward, otherwise we risk extinction. As a country, we need to value what we have. Because ordinarily, when you travel around, you see Ghanaians performing excellently, whether in the US, whether in Europe, whether in China, Ghanaians are performing excellently well. We can also start from here and do wonders. I've always said that the people that we need to be celebrating are the people who are making things happen, not the people who will bring in equipment that will not function, but the people who encourage us to domesticate, to look within ourselves and find out how we can solve our own problems. Instead of going for, if you go to the village, they have malaria, they know the herbs to boil to cure that malaria. Why can't our scientists take that on board? We've been able to innovate that. We've been able to produce enough professionals. At least we don't import teachers anymore from anywhere. We've been able to import, to produce enough healthcare professionals to man our hospitals. Occasionally, Cuban doctors come, but they only come to complement. We've been able to do that in many fields. Why can't we also take on the manufacturing agenda? Why can't we also take on the agenda to produce skilled people who will not only be maintaining, but also to develop this equipment? And I wish to also commend the president of the academic city, because I also read about what they are doing in terms of bringing out the ventilators that solve the immediate problem. If we, as training institutions, work together, we'll be able to make this country a better place. God bless us all. Thank you.
Thank you so much, Prof. He says we should act now or get lost. He's asking, what do we do to change the narratives in our healthcare delivery system? It's time for snack. I want to invite the dignitaries to go first because the numbers have doubled to avoid crowding. So our dignitaries will go first and then we follow systematically for our snack break. Thank you. We'll be back by, we're supposed to have been back by 11, but I'm taking 30 minutes or 30 minutes of lunch break. So we're coming back by 11:30. Is that okay? No, it's just a coffee break. anything you think you want to share with us, you can write it down before we come.
We're going to collect. We are going to collect everything at the end. So if you don't mind, please write down challenges. Yes, any ideas.
President of Academic City University is Professor Fred Magonlori. I hope I got it right. Let's welcome him with a clap offering. He is coming to give us an engineering point of view. Thank you.
Good afternoon. So all the protocols have been established, right? Thank you all for making it here. This has been months in the making. And let me commend Lee, Sam, Nana, Philip Banner, Miss Telma, Dr. Telma. I never showed up as often as I should have. I had a whole world on my back. But I'm happy they did a good job putting this together. And ultimately, if we can pull this, it will be good for Ghana, it will be good for Africa. So I'm here to share with you a practitioner's perspectives of where a center like this ought to go. And obviously, being an academic, you see a few things there on the academic side. So bear with me, it will look a little chaotic, but I'll put it all nicely together at the end. So, you know, Ghana has never really lacked innovation. Sometimes when you look at the innovation landscape, it looks very hopeless. But post-independence, we did a lot of things in this country. Two things went wrong for us. The first was that we never derived new products from the products that we were making. What do I mean? You guys remember rubber? We used to make tires in this country. And that was it, tires. But plastics, you can do many more things from it. Then we did glass, aboso, right? And for vehicles, we made glasses. That's where it ended. Sanyo, radios. And I met a colleague whose slides are borrowed in many places in this presentation, who was actually an intern at Sanyo. And the Asians were in one side of the building, and the Africans were in the other side of the building. So there was never technology transfer. They just maintained them as technicians, and that was it. So when they left with the technology. Now, if you look at our Ghanaian landscape, especially on Saturdays, see a lot of funerals. Sometimes when I drive up north, I go to 7 funerals. I just draw a straight line from Wa to Hamle. And every major town on the road, I know somebody who has lost a relative. And sometimes very young. Now, why am I talking about dead bodies? We do love dead bodies in this country. We'd rather have them dead than alive. The problem is that most of it is needless. You know, I had a friend whose dad was Ghana ambassador to Australia, New Zealand, and Japan. Secretary of State for Defense. Served in SMC 1, SMC 2. Rear Admiral, Ghana Navy. He died on the stretcher in Kolebu. Nobody, incognito. Nobody knew who he was. Why am I coming at you guys from this angle? You have to care about what we are doing today. Otherwise, you'll be dead too. That's the bottom line. Whether you are a minister, you are a president, we all know presidents who would not have died for COVID. That's the naked truth, guys. They would have been flown somewhere and saved. But COVID taught us a good lesson that when it comes to healthcare, it's an equal opportunity employer. Now, about 100 years ago, 2 guys met on a train, and they were headed to a sales conference. They shook hands, introduced each other, shook hands, and started a company called Becton and Dickinson. They were not engineers. The core business is still syringes. But unlike Aboso Unlike Sanyo, they made other derivative products from syringes. And today, it's almost a $10 billion business. Syringes. We used to make syringes in this country. Now we buy them. When I left Becton and Dickinson, we were selling a syringe for 5 cents. But if you make 14 billion of those, that's a lot of money. So we can do it. We've done it before. But if we decide that those who are going to do it are the political class, we're wasting our time. Because they have 4 years to go, or 8 at best. And between those years, you got to stash enough to survive. Because once the sirens die, you are finished. Okay? So let's figure out a way to do it. Now, let's talk real engineering here. Okay, hopefully I'm going in the right direction. So this is what one of America's most liked president, I hope that was the one, there were 2 of them. He says, yesterday's answers are inadequate for today's problems, just as the solutions of today will not fill the needs of tomorrow. Okay? That's not too long ago, right? That's 8 years before my mom was born. Okay, can somebody help? Okay. So I want to touch on a few things that often we ignore when we are talking about innovation. But when I was growing up here, 5 minutes drive from here, those were the days of the electronic watches. We were so fascinated. And we were told they were built by high school students in Japan. And I was just wondering where the next meal was going to come from. So there was some excitement. We've always been excited about engineering. Then our overbearing parents will look you in the face and say, you are going to medical school. You are going to law school. You're not pulling your weight. You may be a farmer. So we didn't respect farming. That's why we're trying to get wheat from Ukraine. Good luck. Then, as I grew up, I started realizing, and even as recent as 2 years ago, when we were working on this ventilator project, I got a call from a gentleman that said, I understand you guys are building a ventilator. I said, yes. Why don't you build a respirator? I'll fund it. So I went to do my research, and he sells ventilators to Dr. Jablate and company. And so there's special interest that actually prevents innovation from happening in this country. Because they'll rather buy and come and sell it with no maintenance agreement and pay government officials token to screw us all up. Okay? Then there is the product development cousin. From the university perspective, I see this quite often. Kids with great ideas, and they just keep getting caught up in an infinite do loop. They don't know how to turn that into a product. They want a perfect product. And in product development, your worst enemy is perfection. You gotta put something out there, then you can learn more, refine it. You know, guys have seen this iPhone 12. Unfortunately, even the president of a university cannot afford 14. But you have to sell a product. It isn't that the features in 14, they didn't know about it when they were at 12. They did. But if you put all the features into one product, how are you going to make the next product? Okay? So we need to work on this, how to help students take great ideas from Professor Kaufman's classes, from KNUST, from UMAT, from Ho Technical, and turn them into simple products. Lee mentioned the small wood project. There are no electronics in it, simple, easy to build. In 10 minutes, you can assemble it. It can go for, he said $20, I said $15 or less. And so, and that's a product, okay. It's going to save a lot of lives. It's cheaper than $80,000 ventilator. Then the kids need to be trained. as entrepreneurs. So I'm hoping a center like this would also provide some support. How do you take an idea and bring it to the marketplace? There's so much going on in the digital world. You know, I'm working with a group of students from Cincinnati and NKU that will just send us, they're going to send us 3D parts that they've designed, and we can print them for prosthetics, for kids that have lost their hands. So technology is not a problem. We just need to figure out what we can do for this place. Now, coming back to what we did, when we started working on the ventilator, we were thinking, Americans never have to worry about electricity. They always had it. So if you tell an American to put a battery in a ventilator, they'll be like, for what, right? So we thought of ways of integrating a battery. We thought of ways of, if you're traveling from Hamley to Accra, which is over 400 miles, with a patient, how do you keep them alive when that battery runs out? So the cigarette lighter is an alternative. Could you also charge the batteries with solar? So these are some of the reasons why innovation has to happen locally. Because an American will not think of all these things, right? So we need to get the products, but we need to make sure that the products are customized for our environment. So you can go in the wrong direction sometimes, you know. So look, I spent some time visiting hospitals, and these are some of the equipment that you see. And I take them back to school and let the kids open them and look at them. And sometimes it's just a block filter. And they've been packed and gathering dust. Sometimes the motherboards are fried up because somebody took a 110 rated and put it in a 220. And when it is not going in, because somebody bright enough knew that the sockets have to look different, they get an adapter and they still push it in and fry it. So they need help. They need help with these things. Nebulizers. I'm going to go a little fast here because I want to get to the meat. So guys, we're talking about simple medical equipment. And here's where the world is headed. A lot is happening. You know, look at King David when he was a kid, right? With his sling. Now the same sling is the machine to his left in this case, right? So what is the gap here? My good friend Joe Krushak presented this at the President's Forum at Pejuasi. I think the only person that was there was Miss Kaufman at this conference. So to my left is Pito. Sam had palm wine yesterday. This is another another local variant from grains. And this calabash has been there forever. Now you look to the right of it and you see Mountain Dew, really, really sweet. But somebody has a handle on it, right? It has evolved from a calabash to an aluminum can, and even there's a holder to it. You know, Ross Perot once said, while the Japanese are thinking of microchips, Americans are thinking of potato chips. So in number 2, when the Americans are thinking about a jet engine, we are still making plastics. We're still making plastics. We got to move. Now, if you look at the technology gap, look at patents applications by region. In Africa, it's actually declining, right? That's a problem. Now, the only thing that is not here is the Africans in the diaspora that are filing patents, right? That is not captured here. So it's not completely hopeless. I mean, a good patent filed in America that makes products that serves the rest of the world is equally okay. But this is a little bit an alarmist that a whole continent, and if you even want to be surprised, Hong Kong produces more Wikipedia pages than the total from Africa. 4 million people. So that's a problem. We need to do better. So here comes China. For those of you that know the technology world, even in the early 90s, we were laughing at Chinese products for their lack of quality. We're not laughing anymore. And these guys are so ingenious that the things that they are doing would amaze you. We went to China a couple of years ago and told a Chinese company, can you set up a factory, make hospital beds, we'll buy 5,000 of them from you every year, you will ship it to us at your cost, we'll sell them, we'll take our margins and pay you. The only catch here is the year we don't buy 5,000, we'll pay for the delta. And they went to work. 2 years later, when we went back, there was an extension to the factory. We say, who are those? Oh, that's for your competition. How do you ensure that the two sides do not mix? They say, oh, come and see the door. You know, this door is always locked. But in the middle of the night, that door is opened. Then we went there the following year, there was a third factory connected, another competition. Then the US government said there has to be local content to the beds that we were making. So then my job was to redesign everything the Chinese designed locally for FDA approval, and then we started making those beds in Mexico. Where else can you get such a business model? Use your own money. Build a factory, produce products for me, ship them at your cost. I'll sell, take my profit, and pay you. And they said, very well, we shall do that. Okay. So, where does Ghana stand in terms of standard metrics of industrialization? 2005, 9% of GDP. 2016, 6%. Where do you guys think 2022 will sit? You're very generous. There is work to be done. There is work to be done. Okay, where does Ghana stand in terms of, so look at the region itself. Look at sub-Saharan Africa, the average is about 11. Ghana can still do better. So I mentioned this, we were good, you know, post-independence, we were ready. This country was fired up. We had over 42 state enterprises. Today, not more than 2 of those are profitable. And don't ask me why. Because the Constitution actually says that the CEO of every state enterprise has to be appointed by the chairman of the State Enterprise Commission. But that is not the case. So it's not a meritocracy. That's part of the reason. So if I leave here and you guys don't hear about me, just send, just fire a few tweets and I'll be fine. Okay. The role of universities. I mentioned earlier that we had all these enterprises, but the research was never conducted by us. We never engaged universities. And systematically, in the last 60 years, we've actually eroded the significance of universities in our national development discourse. I kept hearing that companies are not hiring graduates. There's a chasm between industry and academia. And I keep telling myself, if these companies were getting value, they'll be chasing us everywhere. Because we all know research and development is integral to industries really making money in the globally competitive world. There is no chasm. There's just no value yet. Okay. So look at Nike. 1970 to 2017. It's looking cooler and cooler and more intelligent. And the bottom line is that very soon your shoes will become an integral part of your care. The clothes on your back will have sensors in them collecting data on your health, because those are the closest things to your body every single day. And one day, not too long, your doctor will call you and say, "Hey Lee, can you come up here quickly? Your data," sorry Lee. There are some anomalies, let me put it that way. You know, so as we look forward to this center, let's figure out how we really integrate our universities into it. And let's be results-oriented, because again, you can develop products forever. Until you put something out there, you will never learn enough. 20 years ago, when I went to Siemens, my job was to use 3D printers to make hearing instruments. Before that, companies were using 3D, but they were using them to make prototypes. So we spent some time at Adidas in Erlangen, Germany, and went back and used 3D printers to make hearing instruments. We reduced turnaround time from sometimes 6 months to 24 hours. And that was 20 years ago. So all the technologies are there. We just need to figure out. And I'll leave this. These are all stuff that I've already talked about. So I'll talk a little bit. How much time do I have? As you can tell, I can sing forever. So look, a little bit on the education side. We have to stop storytelling. We have to stop talking Anansi stories and really teach kids how to really go out there and innovate. And if you want to teach somebody how to play a guitar or a violin, do you talk about it or you put one in their hands? Put one in their hands, right? So what I've been trying to do in my university, in my little corner, and by the way, I went to a conference one time, Ghana Institution of Engineering conference in Akosombo. And when I was done presenting, a civil engineer ran up to me and said, "That was a brilliant presentation, but that is never going to happen in this country." So then I looked at him and I said, "Yeah, but I have a university that I run, which is my experimental center." So at Academic City, we want it experiential. So you see, kids are trying to build an excavator from cardboards. Now we're not waiting till we get high tensile alloys so that we can cast them, because then the excuse is we don't have a foundry. But at least you can design them, almost a life size, cut them, put them together. Contextual learning. So the kids there were my students at Ashesi University. And this was at the peak of Dumso, where there was no electricity. So I said, why don't you guys build a portable solar generator? And knowing how important their phones were to them, I said, your device has to be able to run your computer, turn your phone on, and we're actually going to test it with your phone. So if it doesn't work, your phone is fried. Then we do something we call unified learning, where we try to get a common project that students from all across departments get to focus on. So one that we worked on was a smart dustbin, and we had marketing students on it. How will you go sell this to somebody who doesn't understand technology? Finance, what are the logistics of this? Engineers, fit, form, function. Okay. Then extensional. I mean, we can't teach you everything in 4 years. But I already mentioned the 3D printing revolution, right? You still need your scanner, your modeling software, and your printer to do all that. So if you start a company making templates for a dentist, nothing stops you from eventually making ear molds, hearing instruments, and even shoe lasts. Now I think we're at the point where you can actually have a custom shoe made for you, right? So my dear sisters, the ones that you get cones from your high heels because it wasn't built for you. It was based on averages, right? One day you'll be able to put your foot on a little device at the mall, and by the time you are done shopping, your real high heels that conforms to your body form is ready. Okay? So, these are students from 7 years ago. And you can see me there with them. I was always on the ground with them. That's the only reason why I wear jeans, to show them that I'm a common man, I can work with you. Okay? That's a far cry from the corporate world where we had suits and ties. The other thing I try to do with my faculty is, how do you really teach engineering from an understanding point of view? I'm not talking about how you were taught or what is in the book, but how do you put the pieces together so that it makes sense? Now, I always get into a fight with the regulatory body, because a guy comes and says, I teach this course, but I teach it in 2 semesters. I said, okay, I took this course 25 years ago. It was taught in 1 semester. What's the problem? The problem is that there's a practitioner perspective to how you need to teach this versus a teacher's perspective. So I put it in boxes. You know, if you take a first book in mechanics, the first few chapters we talk about displacement, velocity, acceleration, boom, Newton's law. Okay? Okay, now it's a system. Okay, so let's see what happens when you go, how kids want to learn. So now when I go out of this linear frame, reference frame, what does it look like? It doesn't really change. The laws of physics do not change, right? Everything just becomes angular, angular, angular. And if you teach kids this way, they don't see the fat book, right? They really see the connectivity. That I've just changed the frame. It's now angular displacement, angular velocity, angular acceleration, and then torque replaces force here, and the law of conservation of energy is still the same. It's only Newton that is there. Okay? So this is a course that I taught in strength of materials. And each time I start teaching, I put this up there and say, okay, here's the journey. What happened when you apply forces on materials? And here are the tools that I want you to really know when you walk away. And this course is a stethoscope of engineering. If you know how to do strength of materials, you should be able to get a job and make a living. Okay, final slide. So as we talk a center, I'm also thinking, what kinds of skills do we really need? Right? CAD, CAM, CNC, you need that. Okay? I don't have anything here on plastics. You have, well, digital manufacturing and applications. Now you can print powdered materials. You can do so much. We need to get some understanding of alloys and extractives, some brains, microprocessors. We need to understand some software. And I think these are some skill sets that we should also think about, whether we are training people at the center to have these skills, or we are bringing people to the center that have these skills to augment the things that we're trying to do. Okay, that's it. That's all I got. Thank you.
Thank you very much, Mr. Fred Bangolori. Mark Bangolori. Thank you so much. He is saying we should stop the Anansi story and saying that you should care about whatever is going on today, because tomorrow it could be you. Okay, so next on our list, we want to listen to another gentleman, Mr. Anthony Basin, the CEO of Incas Diagnosis. He is going to talk to us from the business point of view. Shall we welcome him? Thank you very much.
Thank you. Funny enough, Prof is my uncle, so it runs in the family. So my name is Lord Anthony Basing. I run a company called Incas Diagnostics. At Incas Diagnostics, we make very simple tests, but that have very huge impact. To talk about the business perspective, I'm going to start by sharing a story of how it all began. Probably would give us the context why entrepreneurship is very important. So generally, I'm a scientist. I am an academic, so I'm a lecturer at KNUST. But anytime I'm going to talk to people, I always talk about my company, because you can have a lot of people. We have a lot of people who are lecturers, but we don't have a lot of people who are developing diagnostics here in Ghana and manufacturing them. So I started off, my first degree was in medical laboratory science, and when I finished, I went to Konfanochi to do my internship, and then I was employed in Konfanochi. And then after a while, I felt that the cost of diagnostics, medical laboratory service was too expensive. Because you check on the internet and some of the products are so cheap. But then the cost of doing the test is so expensive. I didn't understand. I was very naive then. So I was like, let me start my own lab and then give very affordable healthcare to everybody. Unfortunately, it took me 2 weeks to realize that wasn't going to work. Because we imported every single thing. The shipping cost, import duties, and even the markups, right? So it made it very, very, very untenable for me to do that. So I said, okay, what would it take to start producing some of these things right here in Ghana? And again, naive as I was, I did a little bit of reading and all of that. And I was like, oh, this one can be done. It took me from 2012 to around 2018 to actually bring my dream into fruition. So I had to take loans to travel to the US, DCN Diagnostics in San Diego, to go and learn how to make test kits. I did that until around 2016, but that wasn't enough. I had to take a graduate program in biomedical engineering to be able to then have the confidence and the experience and the skills to come and start the company. And I did all of that because I wanted to start a company that could develop diagnostics that would make healthcare costs as affordable as possible. So, but then in the journey, I ended up having 2 PhDs. So it also helped me because I had to do, as I said, I'm a medical laboratory scientist, so I did a PhD in microbiology. That had always been my first love. Basically, academia, teaching. I can talk. It's, as I said, it's in the family. If you leave the two of us, we'll talk for hours. So I felt that teaching was going to be the next level for me. But then when I went to do biomedical engineering and I came back, I realized that no, yes, I like teaching, but I also like making things more. And right now I spend most of my time in the lab developing things. So the next, I think probably he's not there. Anyway, so I was going to show you a few of the things that we do. But at Incas Diagnostics, we have different test kits. We have a test for drug of abuse. So this is a 10-in-1 test for drug of abuse, different drugs. There are pictures there that I could show you when it's set up. We also made some of these things. These are basic medical devices. So this is a handheld digital microscopes. So again, when we started, it was this. But now we have one that uses Wi-Fi, basically. Yes, I would go. So it uses Wi-Fi. Okay. And this was used last year on a project to diagnose scabies in rural communities. Okay. And when you use it, you can actually see the scabies mites under the skin and it was basically children. I think it's been published now. And we did this microscope right here in Ghana. So I have always been interested in academia and industry. How do you marry the two? Okay, so I have the Basin Lab in KNUST where I lecture. We run all of these things. We engineer antibodies. especially with synthetic engineering, we do a lot of synthetic biological products that help us with a lot of the things we want to do. There are certain diseases that are too dangerous for you to have real life, like viruses and all of that. We are able to synthetically engineer some of them and use them in our experiments. And all of this happens in the Basin lab. Now, after we've done that, what happens? What next? Yes, we've done the research, and what next? And the Incas Diagnostics, which is the diagnostic company that I founded and currently CEO, then commercializes those that have commercial value. So that is how we do both. And when it comes to funding, for instance, my academic side is able to write for grants. We get grants to do the research, and that helps us with our R&D, because R&D costs are super expensive, and we would not be able to afford it as a company to be able to fund R&D costs. So by being in the university, I'm able to write for grants to be able to develop or do these biomolecules or these tests. And then when I find any that has commercial value, then the company then commercializes them. And I'm beginning to find out that when you write for grants and you actually put the fact that there's a commercial value, there's a company that can commercialize it, the likelihood of you getting the grant is actually higher, because the funders are seeing that, they're not just giving you money to publish, but you can have real life things. And then when you have conferences like that, you can mention their names. There are a lot of funders I'm going to mention names, and it all gives value to the fund that they are giving you. So that is the academic side. At Incas Diagnostics, we produce lateral flow tests. I'll show examples. We moved into molecular points of care tests because a lot of the tests that we have right now, the antibody antigen tests, some of them are not as accurate as we want them. And so PCR is the big deal. But in a lot of rural areas, or even in Ghana, if not for COVID, PCR wasn't as common as that was necessary. Even right now, even after COVID, some of the PCR centers have even shut down. Okay, so, but a lot of diseases require diagnostics. And so we moved into molecular point of care, miniaturizing the PCR into very basic tests that can be run, even without electricity and all of that. We do a lot of contract manufacturing, so people bring their product and say, okay, we want you to manufacture this particular test for us. We manufacture and give it to them, and it belongs to them. We make money out of that. We also do research, and then most importantly, we do a lot of trainings, because unlike somebody like me who had to take loans and liquidate all my investment to go and learn how to make these test kits, because there was nobody around to teach me how to do that. We have the expertise now, and so we teach a lot of students, especially those in KNUST, how to develop test kits. If you come to my lab, pregnancy test is your start. You come and if you are able to do a pregnancy test within a week, then we know that you are qualified to be in the lab, because it's the cheapest thing to make. Okay, and everybody gets excited when they come, and you are either assembling a microscope or you are putting together a pregnancy test, and it's exciting. And again, as I said, I love teaching, so that basically gives me the fulfillment that is part of the things. Now, for Incas Diagnostics, we currently have about 12 products on the market. We have one product that's currently undergoing clinical trials. Noguchi Memorial Institute is where we are doing the clinical trials. We have 4 products under development, and we have 37 full-time staff. The average age of our staff is about 26 years. Yes, so we have very young people who are working with us. And for Incas Diagnostics, most of our technical people are females. So my CTO is female, most of the head of manufacturing is female. And then for the admin side, most of them are males. Because in most places, females go to admin and males go to the technical area. We've switched it up just so that we can encourage people to move into that. And they're doing a very wonderful job. And then currently, we have a capacity of about 100,000 test kits a day. So we are able to produce 100,000 test kits a day. And this is because of a very kind equipment donation from the Bill and Melinda Gates Foundation. In 2020, they gave us equipment worth about $2.8 million. And that has moved our production. So we're doing a lot of manual right now. We are able to churn out some of these things, about 100,000 of them every single day. Okay. So these are some of the products that we have. There are some of them I've not added. This is a test for drugs of abuse. It's able to test 10 different products, 10 different drugs. So it's just a urine test, 10 minutes. You're able to know whether somebody has taken cocaine, marijuana, any of those ones. We have a pregnancy test for hepatitis B, typhoid. This is a test for 3-in-1 test for vaginal infections. So Candida, Trachomonas vaginalis, Gardnerella vaginalis. We have a test for gonorrhea, chlamydia, alcohol, syphilis, malaria, ovulation, COVID. All of these are tests that were developed and manufactured right here in Ghana. So all the tests that I mentioned, they are on the market. They give us money. I'll talk about the rewards of this. But this product is not on the market yet, but it is actually my highest earner. And the reason is that it's there's a disease called yaws. For a lot of people, they don't even know what yaws is, because it is called a neglected tropical disease. It affects children living in very rural communities, okay, in Africa, the Caribbean, and all of that. Now, it's easy to treat it with a single dose of a drug called azithromycin. Unfortunately, testing it is a problem. Previously, we used to take samples as late as 2017, 2018. We used to take samples and send them to CDC in Atlanta for them to tell us that it is yours before it comes, and then we go and look for the children to treat them. Fortunately, there's been a lot of technology transfer and knowledge transfer. So currently, Noguchi, KCCR can do those tests. And right now, courtesy of ANESVAD, they're trying the Kolebu Public Health Reference Lab, and then some of the public health reference labs will also be able to diagnose it. But the problem is that you have to take the sample, bring it to these labs. It takes 2 to 3 weeks before they give you the results, and then you go look for the children and give them a single dose of azithromycin. Okay, that is a big problem, because sometimes you go there and the children have moved. Their parents, you will not find them. And because they are in very rural areas, there's a common saying that says that where the road ends, that's where yours begins. The first time I started working on yours was somewhere in 2013. And I remember that experience because we're in the middle of the place. We drove like 2 hours. It was still in the same district, but we drove like 2 hours, went and parked, sat on motorbikes, rode the motorbikes got to a particular school, stopped, people came and carried the things we were, and then we walked. I mean, I might be exaggeration, but I think we walked like 45 minutes, because we got to a point I couldn't walk anymore, and they were like, oh, it's just here. It's just here. It's just here. Okay, and when we got there, almost every kid there had yours. And we had to take their samples, come back, send it to CDC. And when the thing came 3 weeks later, we went back to the place, and a lot of the kids, so like they had vacated and they had they had gone on holidays and all of that. And they've gone and they are spreading it. So I worked on yours as part of my PhD. So when I had the opportunity to do my thesis in biomedical engineering, I opted to work on a simple molecular device to diagnose yours. Long story, by 2019, I had developed this very simple molecular device that didn't require electricity. It just needed you to be able to take a swab from the soil and put it there, and within 30 minutes you had your results. In 2019, it was selected as one of the top 30 innovations in health by the World Health Organization. And because the World Health Organization wants to get rid of yours, they said 2020, they were not able to. So now they are saying 2030. And so that was for them a game changer, because now you could diagnose yours or you can just diagnose and treat. So that became a big deal. And because of that, I've made a lot of money from this. All of these organizations have given us funding. As I know, we are doing clinical trials at Noguchi. and we are done. We've sent the results, and we just the day before yesterday, I got an email. They want to do transition to scale, so they want us to then produce, and instead of just doing it in Ghana, look at other countries, Papua New Guinea, Solomon Islands, and all of that. That is more money for my pocket. Okay, so basically, those are some of the rewards, basically, of doing things locally. If I was doing that in the US, for instance, it would not have been as innovative as an African doing it here in Africa. And that's the difference that I feel developing and manufacturing in Ghana or in Africa basically brings. Because then you have knowledge of the problem, you know how to solve the problem, as Uncle Fred said. We also do a lot of work. And then we do a lot of collaborations as well. We work on diagnostic antibodies, wearable biosensors. We are working with Intellectual Ventures to develop this AI-enabled microscopes, where in rural communities, where you do not have skilled personnel, you could actually do this microscope. So my portion is to put together the microscopes, and then somebody from Intellectual Ventures is working on the AI. So basically, we import our raw materials. Unfortunately, there are no companies in Africa that make these raw materials. We can make some of them, but the problem is that it is very expensive, and right now the demand is not. It does not make business sense for you to start doing them. So we buy the raw materials, and then we do the manufacturing at Incas, and then these are the kind of things you do. But then there's also another, something else we do. We do a lot of tech transfers. So there are organizations and universities, Cambridge, Jersey, all of those. So they have companies that have developed technologies that are supposed to be meant for Africa. We do transfers, we do feasibility studies, make sure that they would work. We make our input, and then we assemble them, and then we market them. So that's basically how we make money. Now, what are the challenges? I can use 2 hours to talk about the challenges, but I'll just mention a few of them. First of all, the raw materials, we do not have raw materials, so you have to import them. And in importing them, you have to pay. First of all, a lot of them are not available, especially when it came to the pandemic. There are just about a few companies that actually supply the whole world these products. And shipping to Africa is not part of their plans. So sometimes you have to buy the product. It is shipped to somebody in the US or the UK, and then they then ship it to you. So that is one of the challenges we have. And being one of the very few people doing it in Africa, we do not have enough numbers to attract attention. So that is one of the things. Import duties are killing us. That is something that I have to talk about. First of all, it is cheaper to import a finished product from China than to import raw materials. And the reason is that a finished product from China is termed medical. It's a medical product. And so there are incentives to get them here. The products, the raw materials we use are paper-based. And in fact, the import duties for paper and plastics is very, very high because they are trying to prevent all of those things. So we end up paying a lot more. Okay, and I've been advised by a lot of people, why don't you just stop doing the production here and just send it to China, and then you can still come and sell it. But then my this is that I have 37 people and about 37 million people that look up to us and say that yes, something can be done in Ghana. And so if you just give up and then you send everything just for it to be produced and brought, then it doesn't make sense. So that is why we keep doing it. So, and funny enough, even though it's cheaper to import, okay, our products are still less expensive than what is currently on the market. Because when they import, there are a lot of markups that are added to it. I'll give an example. We sell our pregnancy test for 50 pesos. I see the ladies are excited. But then the market price for pregnancy test is about 2 cedis, 3 cedis, or even more. You get the point. So even though it costs more, okay, to import, ours are cheaper. And yes, it's FDA approved. Okay. Okay, so those are some of the things. It's very expensive. Startup cost is very, very expensive. It's very expensive to put it together. Just one equipment can cost you over $100,000. Okay, and for a lot of young people, it's not something they can comfortably afford. And for us, I had worked in the US for a while. I quit in 2019. I quit my job in 2019, and then I moved to Ghana. I remember when I told my pastor at the time that I was quitting my job and coming to Ghana, they organized a deliverance service for me. Because he didn't understand why I had a good job. I was on my Companies magazine almost every fortnight because of something innovative I had done, meeting this investor here and there, and all of a sudden I decided that I want to quit and come back to Ghana to start a company. He didn't understand. So he thought probably my village people were calling me. So after the deliverance service, the next week I was on a plane back to Ghana. So anyway, so it's not, and when I came with some money. And within a month, it was gone. Everything was gone. That was because every single, not regulator, but any official that would come to inspect. Okay, let's not go there. Let's not go there. I don't want to. because it's look. When I was coming back to Ghana, I had $200,000 with me. Within 2 months, and at that time we had about 7 workers. Within 2 months, everything was gone. Everything. A lot to get things done. Every single thing you need to pay. And a lot of them don't even want to hear the word startup. They'll tell you that if you know you cannot afford, then stop. That is something that is very, very, very challenging. And if you do not have tenacity, you will just stop. Okay, because I remember one of my friends, he used to tell me, if this money you can buy a house. And then at that time I had been given an appointment at KNUST. So he was like, why are you struggling to do all of these things? Just buy yourself a house, just be comfortable, you get your salary from KNUST. Why are you hustling? Okay, but it's all about just proving that it can be done. Okay. All right. And then I talk about access to patient capital. In fact, I should have bolded the patient. Diagnostic development, or even just generally medical devices in general, it can take years from development to even commercialization. And it can take years from the time you conceptualize the whole idea to develop this product to actually doing it. But a lot of investors, a lot of people that give you money, they want to have profits within a year or 2. And so within that time, there's a fight. So, but unfortunately, we do not have patient capital. People who will give you money and be prepared to wait for 5 to 10 years for you to start realizing the gains. Well, the advantage of not having patient capital is that you learn to do things in a hurry. Okay, but once we have that helps. As for exchange rates issues, I don't think I need to even talk about it because we are all aware of some of the problems. Access to information is very, very important. When you want to develop a test kit, for instance, you need to do a lot of work, do a lot of research, know even if it's a problem. Unfortunately, when you do all the searches, what you are going to find is data in the US, data in other countries. We do not have data in Ghana. So it makes it very, very, very difficult to have information to be able to develop the products that you want to develop. This might seem to be not to be a big issue, but it's for those of us who do development and manufacturing, it's a huge problem. Okay, and then so we did this market survey where when we're introducing the 3-in-1 test for vaginal infections, we interviewed over 5,000 people. And we had a lot of questions, but 3 things stood out. One of them, we asked them, whether it was a problem, and 100% said it was a problem. Will they buy a product like this that had these solutions? 100% said yes. And a lot of them even said they would buy it for 100 cedis. And this was 2018, 2019. So if at that time people were saying 100 cedis, 30 cedis and all of that. So we realized there was a big problem. Then we asked the question, will you buy this product if it is made in Ghana? 45% said no. So we realized that we have a big problem. And we need to change the attitude of people, okay, towards products that are made in Ghana. There are people who do products in Ghana, but they put other countries because they know people who are willing to buy will not be willing to buy if it's made in Ghana. And that is one of the problems we've been tackling. I always give an example that when a lady suspects that she's pregnant, she'll go to the pharmacy and keep buying pregnancy tests until she either has her menses or the pregnancy test is positive. She won't ask where it's made from. But let a Ghanaian product be there and she uses one or two. She will say, oh, the product doesn't work. Let me try another product. And if she tries that other product within a time frame when the HCG can be shown, she'll be like, I said it. So we are not only struggling to get people or to make sales and everything. We are also trying to change people's attitude towards the fact that products that are made by us are very accurate. They have the quality that we expect. Now, so these are some of the challenges. What are the rewards? I just used 2019, 2020, and 2021. In 2019, we made 42,000 Ghana cedis as revenue. 2021, we made around 2020, we made around 682. And these are products that we sell. So the grants and everything are not included, but these are sales. In 2021, we made about 1.8 million Ghana cedis. So that tells you that it's profitable. Okay, there's money in making these medical devices. Okay, despite all the challenges we are talking about, there's money. When you look at the growth, we started in 2018 with 7 people. As at now, we have about 37 people. Okay, full-time staff. So the company is growing. We are getting a lot more people. As I said, our production capacity is around 100,000 a day. And as at now, 2022, we've made around $144,000. We started converting it to dollars because just to safeguard this. So that's why this is in cedis, but this is more in dollars. Okay, these are all awards we've won that came with money. Those that didn't come with money, I didn't include them. But almost all of these are things that came with money. Okay, and then of course you've won grants and all of that. So it is very, very, very rewarding to do the manufacturing and then the business aspect and all of that. Combining academia with business basically puts you at an edge, both in your academic life, because then you're able to show that after you finish developing this product, there's a commercialization arm to it. Okay, and as a business, it's put us on a map, and everybody, basically, we get invited to a lot of programs like this because of that. And so I think that with the coming in of this center, it would really be very, very important, especially if you can think about the commercialization of almost all the products that is developed at the center. Commercialization is very important. One, it can be done. It's very rewarding, one, to do the manufacturing. Two, there's challenges, but they are surmountable. They can easily be done. Yes, we need some government buy-in, but sometimes you do not even need government to be able to surmount some of these challenges. You just need a little bit of innovation to be able to do that. It is possible to start and grow medical device manufacturing right here in Ghana and even expand. Okay, it has been done and it can be done. What is currently needed is collaborations and a lot of mentorship. A lot of mentorship. because sometimes it gets tough. Okay, I always say that I quit about 1,000 times every single day. Okay, by the time you are going to bed, you quit. You're like, I won't do this again. The next morning you wake up and you're like, what can we do today? Okay, and sometimes you need people who have been in academia, in industry and everything to tell you that, oh, this can be done. This is the problems you're facing. Can you do this and this? And I think that we need to make a deliberate effort to collaborate with young scientists who are either developing or manufacturing medical diagnostics and mentor them to be able to do all of these things. So thank you very much. I appreciate the invitation.
Thank you so much, Anthony. Wow, that was a businessman talking. That was wow. I'm very impressed, and it looks like in Ghana here, our own system is fighting us. To get something done, it's not easy. But like he said, if we put our minds together, if the government is committed, it's doable. Next on our list, we have in the absence of global health, they didn't come. So we're going to have Mr. Sambar to give us the reason why we are here, what we need to do, and then ask us how to go about it. Let's welcome him.
So one of the key points that we set up this symposium for was to get your input and to learn about it. We have some problems. We're a small group, and the person that put together the website and handled our email had a traffic accident just recently, and his son was diagnosed with COVID. And so we've got to find someone else to take on that. And one of the things that I want to give you is a way to submit things much easier, but it won't be for a few weeks that'll be up. I'm not sure when. So let me go through what we're looking for and why. We're looking for ideas can be a product, a small thing that's needed, as some of the examples were given before, the cuff and et cetera. We're looking for things that might be more dramatic and more significant in terms of how it impacts people. Separately, we're looking for partners that can help us with those things. Many of you have ways of training people, have maintenance departments, etc. If you are willing to partner with us and help us, we will help set up things that do that widely, and that especially do that for rural area as well as urban areas. So, and that addresses a lot of the problems that Robert spoke of, that other people spoke of this morning, and that's what we hope to address. That is, meeting unmet medical needs and helping to improve healthcare, not just healthcare delivery, but help to improve healthcare in Ghana. Okay, so what we're looking for, if you are submitting anything, is a very brief synopsis of what your idea is. It is very difficult to go through. We're going to get so many. We found from the last, we had a workshop, and we got much more than we expected in input, which is very good, but it takes a long time to go through it. And going through all the detail of your suggestion will be very difficult. So when you submit things, and you can do it by email when we get the email fixed, we're looking for a summary so that we can analyze whether we should spend the time now or put it in the catalog of things we'll work on later. And then separately, you can attach things to it, but we won't look at those attachments until we decide what we're going to work on. So your summary is critical. Okay? And so to go through some of the things that we will do is, as we are, let's say, developing a product or a training facility, whatever, we will try to be entrepreneurial about it. That is, we're a small group and we don't intend to raise a ton of money, but we will help people get started as a business if that's what they want. and put them in contact possibly with people that might fund them. Other ways of getting that going. So it's something that will take time, and it's, 4GBI will not be doing everything for everyone. We will try to do the best things that we can do with setting people up and educating, and that's really the way things get going. And so we will form teams of engineers and professional engineers, as well as large teams with students, with government, regulatory, with doctors, and so forth. So everybody's working together to develop something that has, and this is key, is long-lasting, is reliable, is self-sustaining, and that means that it might have to form a company that charges for what it is. We won't be the people that form that company. It'll be the people that are working with us, that 4GBI recruits or is part of us and wants to spin off something. So we will get things done in the best way we can with what we've got without being tied to, we won't work for government, we won't work for hospitals, we won't work for clinics and so forth. We'll work with all these people to get things done. And that's the key. And my experience is this works if you're patient and you work at it. I've got experience doing this around the world with all kinds of needs, both the sophisticated U.S. Where they don't care about money and so forth, and people that have no limited resources, what was said earlier. I've done this many times, and it works. So thank you very much, and after lunch, I'm sure I'll be on a panel and we'll go through some of the detail of what we'll be doing. Okay? Thank you.
I just wanted to take this moment to thank the members of the 4GBI team who are not Ghanaian. For those of us who are from Ghana who live elsewhere, we have a vested interest in this. Sam and Lee have really many other places they could be, things they could do. They're coming here of their own time. Lee taking time from his very busy academic schedule to come in here and to help us. So I wanted personally to thank you both for doing this for us. You didn't have to. There are plenty of places you could be. You didn't have to sit in the car the other day when we went through Eastern Region for 14 hours. It was 14. And didn't feed them either, I'll have you know. So we thank you guys very, very much. It's most appreciated.
Thank you. We will go out now for lunch, and then after lunch, we're going to break up to our panel sessions, which is going to be right here. And then please make sure you write your name, your number, as the paper goes round. The ushers are going around with the paper for you to either sign your name or write your names. And they're sharing a coupon too that we're going to use for lunch. So please ensure that you get one coupon. And let's come back in an hour. There's a mistake here. We have 2 hours for lunch. That can't be possible. So let's come back here for... No, we have 1 hour for lunch. So it's 1:45 now. We're coming back 1:45. divide ourselves into sections, and then it's going to be a sequential section, like one after the other, 30 minutes for each and every section, and then it continues like that. We're going to have 3 sections where we're going to interact. It's going to be very interactive with questions and answers, and then ideas and all of that. We're going to have panels in front here to moderate it all. Thank you. Okay, so can we have the projector off, please? Okay, IT, can we please have the projector off so it won't blind the panelists? Thank you.
I'm not giving a speech. I just like to invite the panelists for the first part. Dr. Robert Jablete, Ms. Rodlin Adache Yamua, and Dr. Easy. And this was about rural healthcare, but I don't practice in the rural area, but I've been to one or two. Rodlin, oh, she's. Oh, this is nice. Some of the challenges that you have taking care of patients in your respective areas. I know Dr. Robert is in Accra, but being a Ghanaian, I'm sure you've been to some of the areas. And Dr. Gazy is from Central Region and Western, oh, pardon me, Western Region. Is it still Western after being changed? I guess it's still Western. Dr. Radi. And my sister here is from the EC region, Achimogorka area. So a wide variety. So I thought maybe ask an open-ended question and see if there are any just some general challenges that you have. Sir, in the booth, could you please turn on the other microphone? Is it on?
Okay, so I believe from Jonathan's presentation, he exhausted a lot of what goes on in their facilities. gloves and all that. So those run very quickly because we keep on using them. Almost every patient, there are some basic things that you keep on using and we run out of them very, very quickly. And the sad part is when you have a patient, it's an emergency situation, and then you are told, oh, we don't have this. We don't have a tube for suctioning, for instance. And it's an emergency situation, what do you do? I think that is where we really get very frustrated because we wish that you always had a supply of these things. Especially, even sometimes at night, 9 p.m., 10 p.m., you need a nasogastric tube, and then you are told there's none for adults. Exactly, 9 p.m. on a Sunday evening, for instance. What happens to the patient? And so I like Professor Alongo's introduction about the needless deaths, because these are the sort of things that trigger a lot of the deaths, actually, because very little things in scarcity. And so just to buttress his point that he made earlier on in his presentation. Thank you.
Well, I did a short stint at Kwalebu when I was a resident. That's where I met Dr. Sarah Bafo. And before then, I had not seen anybody, maybe one person die who was giving birth. And it was shocking to me that every day doing rounds when I was here, there was a maternal death. And a lot of it was from preventable things. So it was really striking. It was almost as if you came in, we're a very religious country, so God had to be with you, because you could easily just go for lack of something very basic. Quite sad. I mean, you can, and this was in Accra. So I can't imagine, in the other areas where are not as sourced. Yeah.
Yeah, hello. So continuing from where she left off, I'm speaking from an angle of somebody who has been in health service administration for some number of years. And few observations as far as issues relating to medical devices, medical equipment management is concerned. I stand to be corrected, but in my over 2 decades of practice of health service administration, it looks like we currently don't have a national policy on medical equipment management. At least if we have, I haven't cited. The last document I cited somewhere was in 2018. And it was in a draft form. As of last week when I checked, that document has still not been finalized, and therefore the draft is still on the shelf. Now, such a policy document will serve as a guide to enable us know how some of these things are to be handled. Once you don't have a direction, you don't know where you are going, then any route, of course, sends you. And it's one area that we may have to critically look at, especially as we have key stakeholders sitting together. Another area when it comes to medical equipment that I would like to look at has to do with the issue of capacity. and I'm taking capacity from various angles. I've seen occasions where equipment have been distributed from various levels to the points of care. And the necessary end user training that is to accompany it, there are times it never comes. What happens is the end user tries to use manuals to understand the parts they feel they will understand and begin operating with it. This, at the end of the day, if we are not careful, leads to shortening the lifespans of some of these machines. There are a number of occasions we also have large influx of students to come and learn under professionals in our health facilities. And when it comes to gadgets such as BP apparatus, the basic equipment that we use, by the time they complete and they are leaving, you are in trouble because large numbers of them are destroyed in the course of it. The other side has to do with the fact that a lot of, as per Lee's presentation, if we're having as high as about 95% of your consumables and equipment being imported, and you don't have certified reps of some of these manufacturers in this country, when you're having issues, you have no choice than to let people attempt certain levels of trials and errors. And at the end of the day, we end up crashing very complicated, complex, expensive machines in the process. And it actually stands as a real huge challenge when it comes to equipment management in our health facilities. Now, medical equipment can be an expensive venture, and issues relating to spare parts remain a problem. In our discussion 3 days ago, I was telling the team that as I sit, for the past 3 months, we haven't been able to do any imaging in my facility because a part developed a problem and we had to move all the way, speak to somebody in India. And the cost us at 3 months ago was about $50,000. Now, if we are converting, I don't even want to attempt it. And a district level hospital like mine will not be in the position to actually bear that cost. And for that matter, the past 3 months, every case that needs that level of imaging has to move to Koforidua or Suhum to get it done. And at times when you have to mobilize the clients to move and bring back, anyway, it's frustrating. That's what I want to say. Then I think it passed through Robert's presentation, and it had to do with the issue of being in too much hurry to replace very simple, usable equipment with highly sophisticated and complicated ones when we are not ready for them. There are certain facilities that are at this level, HB meters will still be useful to them. If you feel full blood count machines are now in vogue and therefore that's what you want to do, and you want to send it to a small health center somewhere where they can't even guarantee constant supply of power to power the machine. Much as sophistication is good, it may not be serving the purpose of that environment. And therefore, as we want to have a look forward, we need to take some of these things into consideration. I've also observed that there are times that there is so much heterogeneity when it comes to certain equipment being placed in our facilities, such that you have 3 suction machines, probably they have all broken down. If they were all from one similar brand, you could have cannibalized to come up with something to get one fixed and working. Unfortunately, we don't have that. So you have all the 3 of them packed in the Roberts equipment graveyard.
Yes.
And then we sit down without them. So as a start, I think these are some of the few challenges that I can place my fingers on as somebody who has worked with biomedical engineers over the years, and I feel there are areas that we can look at and they may be helpful to us. Thank you.
Also, touch on about being in a hurry to replace perfectly working parts with fancier ones. Somebody asked me for a computer, and there was a sale. In America, they do reduce prices on like here, everything just keeps going up. And I saw one that was a nice touch screen thing. I didn't get it because I'm thinking it comes here, something goes faulty, the machine goes away. So I didn't get it. I got an old-fashioned, press the key stuff because I know how it works here. So, probably. And talking about mothballed things, when you were showing your graveyard parts thing, I saw 2 beds sitting there, and they're probably electronic beds, but when we went to some of the health centers, they had no bed, and I'm thinking if I can get one of these aboboyas things, we could probably cart them to Nana's village, but because all they need is a bed. They don't need to be fancy, right? Yesterday I saw one walking around for the group. There was a bed just sitting in the corridor, and I bet you if I walked up with it, nobody would know. People don't have a bed. It's unfortunate.
Thank you. So I think great points have been made. The picture is nationwide. Okay, there may be peculiarities in the various levels of healthcare centers that are available. The situation may be even different between Kolebu and maybe Ridge Hospital, which is the regional hospital. And then if you go down further to the district hospital, the picture is different. But a few points. The equipment policy, yes, I knew sometime they were working on it, but I also haven't cited any finalized documents. But these were things that we've been pushing for, which will go a long way to help us. To make further on that, as you rightly said, there's so much heterogeneity in the purchase of the equipment, such that we say we have limited resources. But then when we want to buy certain equipment, we end up shopping from several makers. And if we need to be able to maintain these devices, we need to train the biomedical engineers on these various devices. So you end up buying maybe ventilator from Spain, from US, from Germany. That means that you have to send these biomedical engineers to all these countries. It makes purchasing the consumables and accessories also another challenge. If it was all being sourced from one unit, then you can just box all of them to one container and bring it at a reduced cost. And sometimes with going on with this standards or policy, we also feel we are low resourced. We ask for aid, grants, and some of these things come in the form of equipment. But because we don't have a policy, we get these equipment coming from several sources, and we feel that there is an equipment dumping. They are actually dumping these equipment on us, and they have nowhere but to end up in the graveyard. What happens is that when we are going out there shopping for these equipment, I don't know the exact details. We can make speculations, but for us as end users, those who actually get the equipment and we use, when you go and research, I don't understand the whole process, but it may take time because there's a lot of bureaucratic bottlenecks along the way, I understand. you have a vision that you want to equip facilities within the country with certain types of equipment. Let me say ventilators. So you start the process in this year. It takes a couple of years before it goes through all the approvals, cabinet, parliament, whenever, and the order is made. It will take some number of years for these equipment to get down into the country. I know of one type of equipment. By the time we got the equipment into this country, the manufacturer has actually stopped manufacturing that particular model. So there's an institution here in this country, or institutions that got these equipment, but then you don't have any parts because the manufacturer has stopped manufacturing that type of model. And we know with this biotech, it's an industry, they also need to survive. So they make a model, you can't change the parts between the models. It's quite specific. So we need to really look at some of these things. If they engage the end users, you will be able to tell that these are some of the challenges. If you need to buy the equipment, whatever bureaucratic processes you have to go through, you need to fast track and make sure that you buy models that will still be in production, because it's quite frustrating when the equipment finally gets to you and you see that it is outmoded. And there are several, I don't want to give specific examples, but there are several equipment, there are several institutions where devices were sent and we couldn't, yes. Some of them have never been used. I know some dialysis machine in some top institution in Accra that was never used. Packed, and they had to buy new ones to replace them. The machines were never used. So these are some of the challenges that we face. And I don't see why we know electricity is not top grade. So I don't see why we still go in for equipment that can't withstand. If we are going to buy this equipment on large scale, I know the biomedical engineers, they will fix something into the machine that can stabilize this current. There are equipment that come. So if we are not shopping for those equipment, can't we tell the manufacturers to customize and tropicalize these equipment for us? We have a lot of sunshine in this country. I don't see why we are not making use of this sunshine. Recently in the news I saw, it made so much news around BBC, CNN, where in Ukraine they were doing heart surgery with torchlight. But we all know, I'm sure those of you are gathered here, it's a normal occurrence. At night the lights can go off, and they even have torches. We have to use sometimes our mobile phones. And the technology is there. Why are we not using it? Inverters, batteries, solar, why are we not pushing for it? And I think this is something that should go into that policy, so that we make sure that these equipment have enough durable alternate battery-powered sources. Because I sit in ICU, and whenever there's an outage, sometimes it may not be within the ICU. Even if you are in the office and it goes, you need to rush, because there are patients on ventilators and you know that it's gone. I can tell you that a lot of the ventilators in Kolebu now, you didn't come and catch me, but the batteries within the ventilators are defective. Because of supply chain disruptions, we can't replace the batteries. So when the light goes, somebody must go and take those patients off and manually ventilate them. Why, when it is there's so much sunshine outside, which could have powered these ventilators? Thank you.
I think all these issues bring home the fact that we need to kind of come up with homegrown solutions to things. We may not be able to do it right this second, but I think we have enough people who have the brains who can think about things. My joke to my cousin was that, I mean, there are cars, I left Ghana in 1979. There are cars that are still on the road when I left that are still going, and nobody can tell me that they are original parts. So if your people are ingenious enough to keep those cars going, I'm sure people can come up with ways to do something, you know, for our medical industry. So we're trying to get things going. Okay.
Related to the points you just made about the protocols, there are protocols, a lot of standards, a lot of policies. In fact, with newborn care, for instance, because of these issues with technology, we were introduced to the essential newborn care package, where it requires more skills and knowledge and the use of less technologically advanced gadgets. And the problem with the health system is that, one, I think that we are not prepared for emergencies. And so we can have all these devices working and everything, but then constantly we should make sure they are working. We should be checking on them at least when you go to the hospital. We have to make sure that they are working. But then it is when there's an issue, then we all start looking for this. Where is that? Where's the ventilator bag and mask? Then you find out, oh, your suction machine is not working. That is, so there should be a system where constantly these things are being checked to make sure that they are working, and as soon as there's an emergency, you can lay your hands on it. Sometimes you don't even know where they are on the ward, you know. And this is the reality. So the system itself needs some changes around engagement of these devices with respect to supervision, and the other thing too with training, for instance. Because when we started with essential newborn care, we were doing a lot of training, and so we did monitoring. We found out that many facilities had everything they needed to keep the newborn survive. And then when the aid got exhausted and there was no money to send us out to do the monitoring, everybody goes back to bed, and we go back to our old state. So the health system itself really needs some attitudinal changes here and there, so that when we have all these, we start thinking about how to get all these devices working and everything. The behavior around it is also suitable. Otherwise, then we'll be at a loss. And so that is these things are the things I want to share. But then I want to also talk about children with special needs. That as we have this conversation, let's think about assistive devices. Because we also have children with special needs that are totally neglected, and nobody's talking about them. They are marginalized. But then I believe that we can also look around and use our resources to help them make stuff that will be useful for them to participate and mobilize and also be educated. Thank you.
Yeah, we're trying to move things along, so I think we'll like to thank our panel and move on to the next panel.
Hear me? Sorry? I had one thought when I was listening to the previous panel, because I got the impression that one of the challenges of bringing instruments from abroad is there's a complete lack of coordination. And so if you have 3 instruments at Carly-Boo, they all come from different places, and you can't take parts from one to fix the other one. But there's also power in numbers. If one could have an instrumentation policy where one developed a long-term contract with a particular supplier, they could then be in a position where you could use the same instruments in multiple institutions. You'd be able to share parts when there was a problem. You'd be able to share expertise in repair and maintenance when there's a problem. So coordinating among different institutions may have some advantages. That's just my thought from the end of the last panel. Anyway, I want to thank everybody in the last panel, and now I think you all know the panelists today because we've seen them before. The topic of this panel is international collaborations and cooperations. I'd originally tried very hard to get a representative from Johnson & Johnson to come today, and it turns out he's got a conference in Rwanda, so I couldn't get him here. And one of the reasons for that is that there are many multinational corporations that have a lot of experience in supplying biomedical devices to all over the world. And I feel like they have a knowledge base that we don't really have represented here today that we need to find a way to tap, because there's some interesting things to be said. In the meantime, all of the people here have either participated in international, spent time abroad, or been involved in collaborations in international. And I think it'd be great to have their insights into what works and what doesn't work in there. And since Fred made the mistake of sitting next to me, I'm just going to hand this microphone off to him and say, you've got 4 minutes or 6 minutes or something like that. And Fred doesn't know how to talk for less than 10 minutes, so we're going to try to see if maybe he can cut it short.
Thank you, Lee. That was very complimentary. I'm a Ghanaian, and a prince. Nana? Yes, so, I had the privilege of working for 3 major medical equipment and devices companies, Siemens, Becton and Dickinson, Jones Healthcare. And I think most of the time when you talk of Africa, you are thinking about emerging markets serving you from Poland or serving you from the UK. And we had quite an interesting incident happen at Jones UK. So, can you hear? Yes. Okay. A Ghanaian delegation went to the UK and inquired about buying hospital beds from our UK office. And the night before, they met the senior executive team. They went out for dinner. They overate. The next day, they were supposed to show up at 10 a.m. They showed up at 2, and their flight was at 4. So that was the end of that business transaction. And so you can imagine me from Ghana sitting in a room and hearing them say these things. I felt really sad for myself, for my country, and for my continent. So oftentimes, these companies are not thinking about Africa as direct engagement. They don't see the opportunities here. They think UNICEF or some Bill Gates Foundation or some other foundation will buy such equipment and bring them over here. And that goes to what Robert said earlier. When you are receiving gifts, who are you to determine which gift it is? If somebody promises you an elephant, you have to remember it eats. So it's not a present, it's a burden. So that's what seems to happen. I don't think the investment trust is in this direction also. What I have seen in the last 10 years is technologies that we used to develop as kids ending up in MIT Media Lab and coming up as the next best equipment in the world. So Africa is a place for combined harvesting, ideas disappear from here, goods get sold to us. I haven't really seen any concerted effort from the major Fortune 500 companies to really establish a strong presence here. Anyway, Lee warned me, so let me be quiet now. But I've started seeing organizations like GIZ or GIZ really coming in and putting some resources in locally. I've seen organizations like Noguchi which is one of our oldest research institutions, really standing up at the time of COVID. Unfortunately, they did not get a contract at the airport to test people coming into the country. It was given out to a company that nobody still knows its origins. So most of the challenges that we have are self-inflicted.
The irony is that we basically have the burden of all the infectious diseases and even the communicable diseases when you talk about Africa. And yet, most of the organizations that build devices for these diseases have no presence here. In fact, if you want, they have Europe, Middle East, and Africa. And if you are lucky, you have Middle East and Africa with their headquarters in Dubai. When the diseases are here, so you buy the equipment, and when the equipment gets spoiled, somebody has to come from Dubai. And if for that person, you do not have about 5 or 6 countries having their machines spoiled so that you come, it will take ages and the person never comes. That is where the main problem is. Funny enough, even funding for research into diseases that affect us, most of the funding is to researchers in advanced countries in Europe and the US. And then we as African scientists are supposed to collaborate with them. And when it comes to building devices, those of us in the biomedical engineering, most of us are in the biomedical engineering space. But when you are applying for a grant to build a device, for instance, they are more prepared to give it to somebody who is probably in the US. And then when the person has built it and they want to test it in Africa, then they want to collaborate with you. Because we have the samples, okay, and they have the money. So when it comes to, there's a huge gap and a huge problem with having, first of all, funds and also having the presence. And sometimes you do not have to blame them. It's about demand. We do not buy most of this equipment ourselves. So there's no need for them to have a presence in Africa when the person buying it is also in Europe or in the US. So again, Uncle Fred mentioned UNICEF. A lot of these multinational countries, organizations, they have their presence elsewhere, and then they buy the equipment, and then they ship them to us, and then we use them. So when it comes to collaboration, I think the first thing we need to do is, if we want to have that equal partnership, where we are treated as equals and not just a place to dump equipment or a place where we can just test out the ideas that they have, the first thing we need to do is to create that demand. It's very, very important. If people start seeing Africa as a real marketplace where they can come and make money, okay, they would have presence here. But if most of the people who buy from them, I remember when I was in the US, I went to Purdue University, and we're being taught about medical devices, and the gentleman came and he spoke a lot, mentioned different places, even mentioned Brazil. I mean, Brazil is a big deal, so it's not the fact that I said even, but I mean, they mentioned almost everywhere except Africa. And I didn't understand why they are talking about resource-limited countries, okay, and they are talking about, they are giving you the different global burden in terms of where the machines, equipment are bought from, in terms of the market and all of those things, and they're not mentioning Africa. So I asked, why is Africa not a market? And I will not forget the response he gave me. He was like, yes, Africa is a very huge market, but that's not where the money is. People buy and then dump it on us. Okay, and so again, if we want to have real partnerships, where we have equal partnerships, where we can bring our contributions to bear, we need to generate that demand. We need to buy and not just receive. Okay, when you are making an input in purchasing, everybody is going to pay attention, and that is when we are going to have agreements where people are going to have offices here to be able to work and maintain them, and we are also going to have, even at a reduced cost and all of those things, if we are able to show people that we can pay, and we are rich, we have the money to be able to pay. If people are able to buy houses and all of that without taking mortgages and all of that, we have the money. So we should be able to generate that demand in healthcare, and then we would have the partnerships that we deserve. Thank you.
Thank you very much. I share in the earlier speakers the challenges, but I want to give you hope, because I believe that if you take the Bible, we all believe in the Bible. Yes, well, you believe in a Bible of a sort. So even if it's the Quran. Equipment, facilities that we need to train the young ones with. But then, how are we inputting into these kind of important that we place our institutions and the country first? But at the same time, I keep saying that we can always innovate. You don't need anybody's permission to innovate. So start doing something at your backyard. If you are a student, listening to my brother here, he had to begin from somewhere. Professor Kaufman, how many projects work don't we have on our shelves? What is lacking is, how do we partner to transform these project works and theses into something productive. It's about time we move away from writing a dissertation and earn marks, and that's it. Oh, I have first class. You have first class, but your mother in the village needs health care. You have first class, but your uncle is ill. They've rushed him to the nearest hospital, and there is no biomedical equipment, even the local one, to reverse the kind of situation we're talking about. For me, it's about attitude. Again, it's about capacity. And also, it's about the young people refocusing. If you look at you look at our country today, we are so polarized. We are so divided. Hardly a minute will pass on a radio station without politicians. You go elsewhere, nobody talks about the politicians unless there's some real politicking going on. Everything we think about the politician. They are important to make policy, but they are not important for us to eat. If you make a garden in your backyard, you don't need a politician to go make a garden in your backyard. It's important that we recognize that the 4-year thing my brother talked about, we bring a stop to it by looking beyond politics. The young people today, you talk to them, what do they want to do? They want to be politicians. They've seen some of their seniors. In fact, there are politicians in Ghana, and it happens only in Ghana, where their whole CV, the only work they have ever done is national service. And even the national service, perhaps it's at the office of a minister or office of the president. The rest is MP, the rest is minister. And so this is what the young people are looking up to. And I tell my students that, look, you have to aspire to be a professional first before you can join politics. Because if you are not a professional, then you will just be a choboy shouting boy or girl. And that will not lead us anywhere. And it is important that we continue to value this international collaboration. We need them. We can't run away from it, whether you like it or not. Because for you to even begin, you have to go somewhere through a collaboration to understudy, to make sure that you had additional education and what you are doing is now attracting attention. So we have to look up to the young people like him and also realize that we can make a difference. And the difference you have to make for Ghana depends on you more than any other person. And for us as educators, we must provide the interface for these young people to come up. We may talk about that, but at least if we are able to get even 5 every year in a particular class, making this kind of difference, I'm sure Ghana will be a better place. So the international collaboration is very important. We need it to be able to develop. Like, that's why I like reverse engineering, whether the negatives about it or not. China did that. I mean, let's have a photo of the thing, open it up, and then we make Dr. Fine by localizing the thing, the environmental conditions. We put it there and call it our own. Nobody talks about copyright anywhere. It's important that we talk about it as an intellectual. It's important. But at the same time, I can look at why is it that we have bottled water. Belacqua is there. Which one? Voltic is there. They are all there, but they are bottled water. You can look at this one and make your own and call it a Ghanaian bottled water. And through that internationalization, we can make things well. I'm setting up a maker space at my place through a project with the Germans. I told them, the Fab Lab we're setting up, I want my students to be able to, in the next 2-3 years, to mimic this equipment and produce one for ourselves. We have to put it in the agreement. When we produce that one, we've not copied you. We've looked at your example and built our own house. Thank you very much.
Thank you. I'm going to open to questions in a minute, but I just want to say one thing. You said that you wanted to convince the youth of Ghana to put effort into Ghana. And I think what we want to do is slightly different, which is convince the youth of Ghana that there are huge opportunities in Ghana. And I want to hear from Dr. Bassing answer to one question. Your story is a great success story that we want to be able to tell to other people. If you were working with professor students, what is the first piece of advice you would give to someone who wanted to start a biomedical instrumentation company? What would you tell them?
Well, I think the thing I'll tell them is just start. Just start, because if you want to wait till you have the money, you never have the money. If you want to wait until you have all the experience, you won't. And I like Uncle Fred's example about the iPhone. The fact that, they could have started by developing the iPhone 14, but they started from iPhone 1. And then it moved. So you always have to improve. Again, I show the example of the microscope we did. The first one, which is for scabies, okay, it's a digital microscope. You needed a laptop, and you needed to plug it in and all of that. It works. But after a while, somebody was like, oh, but what if I don't have a laptop? What if I had a phone? So again, and we didn't have that expertise. So we brought in somebody who taught us how to develop this microscope without plugging it in and all of that. It uses a battery you charge. And then it uses Bluetooth that you can easily connect to your phone. And now you can view the things on your phone. Probably would keep iterating it until we get it perfect. And so if you don't start, you would never start. So sometimes you have nothing. And this piece of advice, YouTube is actually one of the places you can learn a lot of things. Look, a lot of the things I went to learn in biomedical engineering, okay, 90% of the things I do right now, I didn't learn them in school. I had the theoretical basis, so I know that if you take this and you do this and you do this and you do this, you come out with this. But the practical steps, I learned from YouTube. So you watch YouTube, you get the thing, and then you fix it. So at that time, you are basically learning how to fix things. And if I mention some of the things that I put together, lots of various things. Okay, some of them will work, some of them will not work, some of them will be worse, some of them, in my opinion, I feel are better, and all of those things. But as you practice and all of that, you realize that you become perfect. And then what your real interest would basically emerge as you go. And so it's a long answer, but to summarize it, just start. That will be the advice I would give.
But the way I often put it is I've spent a lot of time hiking up mountains, but if you sit at the bottom of the mountain and look at the top of the mountain, it looks like a really long ways up, and you wonder if you should do it, but then you look down at your feet and you just start. And that's your advice, just start. Questions from the audience? I see a question back there. Here, let me see if I can do this. There you go.
Yeah, my question is to my brother in the middle. You talk about watching YouTube. Please, the data is too expensive. So how do we do that?
I have a son who lives in Eastern Europe, and he pirates everything. I don't think that's good advice. Yes. Okay, good. Oh, uh-oh.
The data is expensive, but a lot of you are on Instagram, aren't you? Same business. Uh-huh. I have oh, I'll let you guys. I won't hoard. I did. What I find is that what we feel is important to us, we spend money on. Okay, so look at our funeral industry. That's the one place we innovate, right? When my aunt died, the undertaker came, was an empty room. The morning when we came, it was a beautiful room, curtains. It was amazing. She came with a little suitcase. So when it comes to AEs, we are the bomb. So we need to invest the other way, because we seem like we invest a lot of money and stuff when people die, right? So the data, Instagram, same thing.
I think both of us want to talk about the data issue. I think that for a lot of us young people, we need to really prioritize what we want to use money for, okay? You need to think about it as a business opportunity. You are gaining a skill to be able to make money out of it. Once you have that, you have to invest. When I decided that I wanted to develop test kits, first of all, there was nothing like that in the whole of Africa for anybody to teach me how to do it. So I took loans. Okay, I didn't have money. Yes, I had some investment there, but it was not enough. When I went to DCN, I had to pay $4,000, okay, every month for about 6 months. Okay, my flight, my accommodation, I had to go and stay in a hostel and all of those things. But I felt that it was knowledge that I needed because of the plans that I wanted. So I took loans. I was working at Konfanachi Teaching Hospital, so I was a fully employed person. And what I did was that I couldn't also quit my job. So anytime I'm on leave, so I did this for a while. Anytime I'm on leave, I'd ask for an extra period, and then I'll spend about 2 months. The next year, the same thing. The next year, the same thing. But in between time, whatever I had been taught, I practiced. And so when I finished learning, I started learning how to develop test kits in 2013. In 2018, I think, yes, 2018, I was awarded by the same DCN. They have this Lateral Flow Innovation Awards. I was awarded in the same reason for innovations across the years. Okay, it was because of what I needed to do, and so I spent money to be able to do it. And today, I can tell you for a fact that I've finished paying all those loans I took, and I've even made profit. So if you want to, if you are interested in learning something, you would find the money and buy the data. You find the money and practice. You find the money and buy the raw materials to practice. And when you are, and you spend, yeah, exactly, the time. When you are done, and then you realize that you can actually make gadgets, things, you realize that all the money and the time and effort you put in is very small compared to what you're getting out of it.
You see, again, let me just add to it, because the young people need help. There's an adage in my language that if you don't know how to run fast, you must know how to hide. Data is expensive. So for me, this is part of the book of Lamentation. So you look at Psalm 23, the Lord is my shepherd. Now, the young people don't sleep. There is free data at midnight. If you really want to innovate, the time you use in keeping wake in the pub, use it to use free data to watch YouTube for your innovation. Thank you.
I see we're getting into trouble really fast here. Other questions for the panelists?
Thank you very much. So we've spoken a lot on capacity building, and what I would want us to look at is how do we incorporate capacity building into our academic institutions? Because here lies the case where, as a good friend of mine said, our curriculum, especially in the public sector, for teaching students, it usually ends up churning out academic robots, if I would put it that way. So how do we train the trainers, the tutors who are supposed to train us, to make us innovative? How do we train them? And then how do we they end up training the students as well? And then how do we incorporate international partnerships in terms of exchange programs and practical sessions to be able to build up the students to think innovatively? Thank you.
Okay, let me just maybe give
some little information on the capacity building. I was just discussing it with Professor Fred, that TVET is organizing something of that sort. We are looking at 12 different sector scale areas that include pharmaceutical, pharmaceutical and direct. We have the medical devices and disposables and others. Then we also have textiles and garment, hospitality, beauty and fashion and others. So within the curriculum, as I said earlier on, we are now trying to develop the strategy to be able to build the capacity and the skill of personnel in these areas. So when the strategy is done, we're now going to roll out the implementation. So that's one form of capacity that we want to build, skills to feed those industries. Thank you.
So for those of you who are wondering, he's just joined us. He's the CEO of Federation of African Medical Equipment. His name is Mr. Anthony Ameka.
Thank you, Mr. Ameka. We're down to 2 minutes.
2 minutes? Okay, 2 minutes, all right. Okay, 2 minutes. So look, I think our educational system went off the cliff somewhere when institutions started moving away from their mandates and tried to be everything for everybody. We all knew where KNUST came from and what its mandate was. We knew Legon, we knew UCC was supposed to train science, STEAM teachers. Now they do law, they do medicine, you mentioned. So we have to be intentional about the kinds of skill set that our graduates need to have. We need to have a national plan, what we want to be as a country when we grow up. Now we want to be everything. If you look at the private universities, in MBA for procurement and logistics, you're going to soon run out of money paying teachers to teach one student. So I really think that we have to revamp the curriculum, and GTech also has to be listening, because you don't need 156 credits to be an engineer. It's all going to be theory. My daughter goes to Northern Kentucky University, and she's going to need 98 credit hours to get a bachelor's degree. An engineering student at Academic City, minimum 156. And my daughter is going to be making more money than you. So we need to be realistic. It's not how many courses, it's practice, industry. We need to bring industry in. We have some exchange programs. I'm coming with Northwestern. Northeastern is going to come on board soon. WPI, Virginia Tech, University of Dayton. We bring in students from abroad to work with our students, to exchange ideas. We need to do more of those. We took the small wood project from Lee and tried to prototype it here. We learn new things. We actually modify it a little bit. So I think we need to do more of this. And my students need 3 internships minimum before they graduate. 3. So that's what you need to do. And one last thing, and I need to say this. Ghanaian university students are so obsessed with making money, and that is not good for you. Learn to volunteer. Learn to shadow people who have skills. That will make you a better employable graduate than trying to make money on day one.
Yeah, thank you very much. So again, in addition to what he said, the exchange programs, I believe in the last 2 years, I've exchanged over 50 students worldwide. Spend semester abroad because they have the equipment there, they come back, and then they are asked to do something different. The other point he made is that for us in the technical university, our education is a 3-pronged approach. Classroom, for theory, you go to the workshop or the laboratory for experimentation, then you go to industry for practice. So for you in the mainline traditional universities, take interest in what is happening in industry. You don't have to wait for your professors to tell you. If you are doing biomedical engineering and you go home, find somebody who is in the field and try to explore. Our colleague is here. He's all over the place for us, and he's ready to partner with us. So this is the way we can progress and become more excellent, skillful people. But the rest, I want to also say that you say, how do they educate? We, the educators. We are all conscious of it now. All over the world, professors are conscious about how do we transform the education to make it more and more relevant. Thank you.
Let's thank our panelists. Thank you very much. Okay. There's one more panel, and at the end of that panel, we're going to have a summary session where we can perhaps identify some of the more important issues that we've talked about today. So, panel number 3.
Yes. Oh, you want to change the battery? Yes, please. This one. Just get some setup before we talk, because I think that will help us. I was hoping to project, we did a tour of about 5 health centers, and they gave us our needs. Before you can innovate, you need to know what the needs are so you can innovate. Now, most people think of innovators as engineers and all that. We are all innovators. What happened? The microphone, you can't hear? We are all innovators. We all see the problems, we know what's breaking. The question is this: we don't think about how to fix it, because we're not really trained like that. You don't have to be trained. You know what the problems are. Suggest it, tell people. So we are all innovators. I want to start there. The thing I want to talk about, the first thing is, it's a bit loud. Blood pressure monitors. At all these health centers, that's one thing they mentioned. They want blood pressure monitors, and they keep breaking, right? And what are the breaking spots? Anybody? The cuffs, the plastic, right? It keeps breaking. So that's a key innovation point. I want you guys to remember that as we talk about that. The next setup is entrepreneurship. Now, entrepreneurship, how do we make difference? Okay. Madame Divine is the hospital administrator for the Kibi Regional Hospital. We were just talking, she told me that latex gloves, just latex gloves, they make about, they spend 12,000 cedis a month on just latex and surgical gloves. Just gloves, a month. 12,000 times 12 is 144,000 cedis. Gloves. That's just her hospital. Her hospital is a regional hospital. There are about 23 of these hospitals just in the eastern region. If you do the numbers, somebody can do the calculator, that's about 3,300,000 cedis a year for just latest gloves. Eastern region. There are how many regions? 16? Let's just take 10. 3 million, because they might be small, bigger, whatever. 3 million times 10 is how many million? 30 million cedis on just gloves. If you're an entrepreneur, what's going on here? Geez, I can make money. Okay, let's divide 30 million by 15, right? 15, $1, 15. That costs $2 million of cost for just latex gloves. As an entrepreneur, what are you thinking? Can you buy a latex machine? How much does it cost? We're going to talk about it in a minute. So I want to start with that as we talk about it. So let's start off with the, where's the microphone? That's it? Okay, we just move it around there. There it comes. My first issue is about innovation, right? In addition to the blood pressure cuffs, they talk about drip stands. How do we innovate that? They talk about other things. So maybe the panel can go across. Maybe who's going to talk about innovation? Sam? And then I get the two guys that are entrepreneurs. And then we'll deal with the latex issue. And I'll bring in investment, yes. And I'll bring in Mr. Anthony Basing because he's got some key points I think he can also help. So don't worry, I'll put you, don't worry. Okay, Sam.
Okay, so latex.
So try and focus it on, like I said, the blood pressure cuff thing.
Okay.
How do you innovate that?
Blood pressure cuffs. So the key is that they deteriorate. You have to figure out if it is the cuff itself or the tubing. Maybe it's one or the other. Let's say it's the cuff. Then you work on getting a material that doesn't deteriorate. And that's something that can be developed. And in fact, Northeastern has some materials labs that does testing. And I happen to have graduated from Northeastern, and that is an excellent lab. They also have some other things that might help in terms of how you preserve, even the cuffs that you have might have a way to keep them from being deteriorating. And it might be something you produce something that is exclusive to Ghana because it's not needed elsewhere, or exclusive to areas like Ghana. And you might make enough where you're exporting also, okay? If it's just the tubing, however, there might be a way of having the cuff have a connector to it, and you just put the tubing in and put the tubing at the other end, and it might be something you just replace the tubing periodically. And you sell, in other words, you look at it and you learn about what the real problem is before you try to solve what seems to be the problem. And the key is to look at each thing you're looking at, you try to find out what are the problems, what else is involved. There might be transportation costs, there might be something else costs that change the whole nature of what you're doing. And I could go into latex gloves later about that. But the point is that you don't just look at something and say, oh, cuffs. Well, we replaced the whole cuff. That's okay. That's not it. The other thing is that as you're trying things, don't be scared of failure. In most entrepreneurial efforts, most innovation efforts also, both, you fail sometimes. You fail many times the first time. And don't be scared to try. Learn from it. Whatever you had that caused the failure, what could you do differently the second time around? Even if it's the same problem or it's some other problem, approach it differently. Okay?
All right. Thank you, Sam. Anybody want to
All right. I'm Douglas.
Introduce yourself.
Okay. My name is Douglas Aiti, and I'm into innovation. I also do industrial automation. I am an entrepreneur. I have a startup that has employed over 15 people, right, from different universities, from different backgrounds, and set up a space, a STEM lab, that is able to support skills development at that where we are making great impact in our educational system. So when you talk about innovation, I'll center the innovation around, let's say, our educational system. That is where the challenge is. People's ability to innovate depends on their exposures, the kind of things they've seen before, the kind of experiences they've had, and all of that. They can approach a problem and they cannot solve it. They cannot solve it because they have they don't have the know-how, right? And somebody to say that I have learned something, then you must know why, which is the purpose. You must know what, the process, and you must have the know-how, which is the skills. And if you cannot put all these three together, then there's no learning for me. So a lot of people, last 2 weeks I had somebody come to me and says that I've completed IT, right? And for the past 2 years, she has no job. So she's looking for a job. And I asked her, what skills do you have? She said, I have a certificate. Right? So this person, having graduated with an IT certificate, cannot innovate because there is no experience, there is no, exposures are very weak in that extent, to that extent. So now I say, okay, I'll give you opportunity for internship where I'm going to train you and then you become employable, right? If you are good, I'll hire you. If you are not, then I will not be able to hire you. So when it comes to innovation, for people to be able to innovate, even at the medical center where they have, let's say, a part is broken down, the people cannot, let's say, if you check, Dr. Fred was saying that when he took the medical device to his school or the workshop, he found out that it was just a fuse problem. But they had a biomedical unit there. What is the problem? So the people's ability to have the know-how is key. So innovation starts small, right? It starts small, but you need to give it a start. You in the first time, I tell people, yes, you are welcome to this particular environment where we celebrate failure. And then they are like, how? What is that? What are you saying? They are coming from a background where the word failure is a taboo, right? And then they are coming to an innovation space where you have the microscope, you have oscilloscope, you have multimeters, you have consumables to try and do everything. You have 3D printers, you have even VR, virtual reality, and all of that. I have all of them. I have drones and all those things. So you have come to a place of abundance, but you need people who can think to innovate.
Thank you for that contribution. I differ a little bit from that because I believe innovation, sometimes we make it sound like this grand thing. You have to be this, all this university, college education for that. No. Observe something, the same problems. A 6-year-old, okay, if you listen to them, they can actually help you create and solve problems because they're observing it. That's why I keep saying that you especially, you guys, the nurses who are on the ground, especially at the health centers. Like I said, I always say, yesterday I was very impressed. They do magic with what they have. They do magic. And it's amazing. So simple things like drip stand, they don't have it. But I am sure we all know carpenters. We all know things. And maybe you have suggested it, and your boss is like, come on, we can't do that. Or HIFRA will come and say, that's no good, right? The standard people. Look, HIFRA, sorry, not HIFRA. What did I say? Okay. So my point is innovation. Yes, we need all that fancy stuff, but at the same time, you know what the problems are. Let's solve it, right? I keep going back to the blood pressure cuff. The point where the plastic tube meets the device, there's a little plastic thing, right? How do we fix it? In terms of innovation, maybe we don't have to invent the whole blood pressure cuff. We just don't need to. Maybe that small part, we take it apart, get some 3D molding or the molds, pour it with a different plastic. That is innovation. That's creativity. But that only starts when you know what the need is. If you don't know what the need is, we can't do it. I don't want to keep talking. I'll let the panel talk. I think you are an entrepreneur, so we don't have too much time because we all want to go. So let me shift very quickly to entrepreneurship. At the end of the day, that is very important. Let me go back to my latex example, right? $2 million. $2 million for just latex gloves. You are an entrepreneur, right? Can we make it locally? Well, sorry, the question is this. $2 million gloves. Can we, to you, is that something you want to take on and say, I want to do this locally, or is it cheaper to import, as Anthony Basing said? Tell me how to make it.
Thank you very much. I'm also called Anthony, so you have a solution. Yeah. And I might say that this is a good forum or platform, and if we are unable to come out with something concrete within a year, anytime you invite us again, we won't come. We want to see action. We don't believe in the talk shows. So within a year, I'm challenging the organizers that we want to see something concrete coming up from this meeting. The last publication that we made, the Federation of the Medical Devices and Equipment, we indicated about 98% of medical devices used in Ghana are imported. Then I think last week, if you look at the publication from the Office of the Vice President, I think he attended a certain program, and then he made it clear that he wants companies to collaborate with the government to establish their presence in Ghana to produce consumables for dialysis. Now you talk about gloves. Why? Kwame Nkrumah established a rubber factory. What has happened to the rubber factory? That we are importing gloves. What is happening? And it is good we have the academia, we have the businessmen, but where are the politicians? Who normally at the end of the day take the decision.
Forget them. Let's move.
No. I'm building a point.
We got to solve it. Forget them.
I'm building a point because if I decide to start to establish a factory in Ghana to produce the gloves, there are a lot of taxes that I have to pay at the end of the day. My brother will tell you the frustrations that you have to go through in terms of taxation, in terms of levies, in terms of fees. Sometimes you have to try to invade some of them, else your haircut. So sometimes it becomes disincentive to go, or it discourages to go into investment to produce certain type of products in country. So what we are looking at is, as a federation, we've been able to partner with Dawa Industrial Enclave to acquire a certain number of acres for companies to go into production in their enclave. As I speak, about 2 or 3 companies are already preparing at the different stages to start production of certain type of, like hospital gowns and other things within the enclave. So we are looking at a situation where we could have certain type of incentives to be able to bring the raw materials, because even the raw materials have to be imported. It's just like medicines. All the APIs, that's the active pharmaceutical ingredient, are imported. The input, the equipment, everything are imported. The human beings who have to install the equipment are imported. And we ourselves, if we don't take time, we will import ourselves.
Thank you for that. But seriously, on the gloves issue, Emmanuel here from HIFRA, we did the research on Alibaba. You can look right now. There's a machine for making gloves. It costs $16,000. That machine has a capacity of 900 gloves per hour. Okay? There is the middle range, $200,000, about 200,000, 20,000, 10,000 per hour, and then the far extreme is a $490,000 latex machine. Okay, I've given you 3 examples: 16,000, 20,000, 200,000, and 490,000. Once again, as an entrepreneur, right? At the end of the year, the whole country spends $2 million on gloves. $2 million. You can buy a machine for $16,000, and you probably can. Well, let's push it to maybe. Basically, what I'm saying to you is this: even if I get the machine, Madam, I'm going to put you on the spot, Madam Administrator. how do you buy? Would you buy it from me, the local producer? Or, as Mr. Anthony Basing said, it is easier when it's imported. So the question is this. I am now making it here. Would you buy it from me?
Can I help her?
Let me put it on the spot.
I think within the pharmaceutical space, we were having that challenge that most hospitals were not buying the locally produced products. So through engagement and collaboration, the Ministry of Health decided that at least the procurement of medicines by the hospitals, 35% must come from the local manufacturing companies. And I think through the tender or the framework contract, they try to at least get between 30 to 35% procured from local manufacturers.
So 35% of 2 million is what? Somebody do the math quickly. 600,000. So you can earn 600,000. Would you buy it from me?
You insist on putting me on the spotlight. Yes, so I'm just coming from one facility. I cannot speak for everybody. But the glimmer of hope I can give is the fact that facilities have some level of autonomy in the use of our internally generated funding. So if the fear is that if I should produce, I'm likely to be blocked at this level by this official if I don't do A, B, or C. That fear is not there too much because, for example, for my facility, the facility chooses where I want to buy my gloves from. And it is based on competition. Once your quality is something we can work with and your price is good, nobody ties my hand to buy from A person or B person. There are certain level of when it comes to the pharmaceuticals, probably we could have certain differences when we are guided to first source from the regional medical stores, and then it's when we don't get from the RMS that we then go to the open market. But for majority of the non-drug consumables, it's actually not like that. And I can assure you that majority of hospitals are buying from the open market. Competitiveness in terms of price, and if we're able to do something that we feel is approved by FDA, why not? We can all start from a point.
So you buy from me? You have no problem. We all set. Let me give it to, and he has an insight. That's why I'm giving it to him to re-answer the question in terms of local production. Okay. I'm making blogs locally. Can I make it?
Yeah, okay. If the question is, can you make it? Yes, you can. But let me just give a few numbers. When you talk about importing the equipment, buying the equipment and all of that, and then you go to Alibaba and let me just use the 200,000 one. First of all, when you actually want to buy it, you're not going to get it for 200,000. I think that you should note, because the amounts that are there are not most of the time the amount you actually end up buying. And then you are going to have to ship it. So you're going to pay shipping. Then if you are shipping it by sea, when it gets here, you're going to pay about $46,000, cedi equivalent of $46,000 for the 200,000 equipment if you ship it by sea. If you are shipping it by air, you're going to pay about $80,000, which is the cedi equivalent of $80,000. Okay. Now, it's going to take about 4 to 6 months for you to produce, for FDA to give approval and all of that. You need staff. Okay. FDA insists on a certain minimum number. Okay. As a consumer, I'm always very impressed with how FDA is very diligent when they come to inspect our place and all of that. But as a business, it's very stringent. They don't know that you're a startup. Okay, so whatever, when they come with their checklist, they insist that you should have everything. So you would have a certain minimum number, whether that number is useful or not. That number you should have a quality manager with the quality control people and all of those things. Probably doing something that one person can do, but they insist you have it. I'm not trying to discourage this, but I'm just trying in terms of reality. By the time you go through the whole process, you might actually end up, while you might think, oh, $200,000 can get me this, you might actually end up spending about $1 million, $2 million just to set it up. And when you are done, then it comes the purchasing. And that's when you realize that there are a lot of people who would actually bring imported products and pass it off as local product. They go to China, get it written in their names, and then they qualify as local product, and they are part of the 30%. So you're not getting all the 30%. You might actually end up making about 1%, 2%, or 3%. So that context should be thought about before we start jumping the gun and buying 200,000 worth of equipment.
Are you basically saying we can't do this? Basically, is that what you're saying?
Strange thing. I have some experience with latex. Okay, one of my inventions was balloon tip catheters. It turns out that the air quality is critical when you're making latex gloves, and that it's different. And also, you're talking about buying molds. You have to make a ton of molds. You have to make a lot of molds in order to compete with overseas. And that's not just, $15,000. That's millions of dollars. The next thing is that latex in a latex glove is a very small weight. You're not using a lot of latex in order to make that glove. So having it here versus transporting it somewhere else is not the big factor. You're not getting that much of an advantage because you make it here in terms of having the latex here. Also, meeting the regulatory affairs, which was brought up, is a major thing in gloves. And if you buy gloves that are not, that actually infect other people and so forth, you can be in big trouble in any place in the world, including Ghana. So latex gloves would not be my first choice to go into, unless you have something special about the gloves that other people cannot meet, or that are exclusive to Ghana, or exclusive to Ghana-like countries, like I said about the cup. So you have to understand all of the factors, what I said before. You have to understand what you're getting into before you start on that. Gloves would not be my first choice. I might be wrong.
You want to add something? Oh, sorry. What happened? Oh, yes.
So I think what we learned from that discussion was that deciding to make an investment is complicated. And so we should pay attention to Dr. Bassing and do our research before we jump in. But it also brings up a topic we haven't covered, which is in order to move forward, one has to have a certain level of capital that we can invest in. And that's something we haven't covered today, and probably don't have a chance to cover today, but it's something that we do have to keep in mind.
There is a way to get into this, and that is if you partner with somebody that makes gloves elsewhere and they're willing to put a factory here, then you can have labor here, you can have less shipping, not big factor, shipping costs. You can make a business out of working with other people who already have the technology, that understand all of the details.
I don't like the politicians very much, but maybe we will need them to give us incentives, right, to make these local production work, seriously. Because I will not accept that we cannot make it. No, that's not happening. We have to find a way to make it happen, and we're going to make it. I think you want to make a contribution? Or are you good? You're good. Oh. Oh, okay. He was asking, well, you wanted to... I don't know.
Okay. So let me also assure those who want to invest, there are a lot of certain incentives that are in place for those who would like to go into investment in Ghana. For instance, if you look at the Free Zone Act, if you're able to produce within or certified within the Free Zone enclaves, you'll be given certain type of incentives. If you are importing your raw materials, the input, there are certain incentives that are also given. As my brother indicated earlier on, the only challenge we have is sometimes certain type of products you bring in, like the raw materials, categorization under the tax regime is quite a challenge. Sometimes it depends on the discretion of the person who is on duty at the time of assessing the tax liability for that company. So we as a federation is also trying to see how best we can engage to be able to have a harmonized tax regime within the industry. So yes, we have the enabling environment to invest. We all need to come together as a body to be able to push for more incentives to be given to the industry to increase our presence within the country. Thank you.
One small contribution from him, and then we'll take maybe 2 questions, and that's it, right?
All right, so thank you again. What is also needed in this regard when it comes to the product, let's say the gloves manufacturing, is the raw material, the cost. Where are you getting the raw material? Are you going to add the raw material to the machine you are importing because you have not innovated the machine yourself? So all of this becomes more complicated. But then if you are focusing our attention on building simple solutions, because if you take a medical device, for instance, sometimes what is actually needed to help revive the patient is very small portion of the whole innovation or the whole machine. Can we take the law in terms of legal engineering out of the system and still focus on what is solving the patient problem? And that is where we can do, that's something we can do. Otherwise, we'll keep saying that we cannot do it. But let's say if you take, for instance, theater lamp, right? It's something that we can do here. You get it? This is something that we can do here. We can manufacture it here in Ghana, right? Because I have colleagues from Northeastern who will be coming next year. They went to Ethiopia, and then they visited the hospitals, and then they realized that they were having problem with the theater lamp. They look at what it's the whole system, and they innovated one, and then they tried to use it in the hospital, and that is solving their problem. So they took away all the complexities and just focused on the ability to have the light to be able to assist in the theater. So let's focus more on innovating simple things within the hospitals.
I like that can-do attitude. I think I really wish we had more time for this. We can speak all day. There's a whole panel on this. But we're going to take 2 questions because I know you guys want to go home. Anybody have any particular comment or question they want to add to? If not, we'll wrap up early so that we can leave. Yes, miss. Let me give it to the microphone. While I do that, I walk to her. So I did his totals. The machine is 200,000. The taxes is 60,000. Maybe I pay maybe I'm up to $1 million, right? $1 million, and I can get 600,000 a year. I still think in 2-3 years as an entrepreneur, you will make off, and you will make extra money. I still think, but who am I?
Thank you very much. So I think I would like to talk about capital. Right? If you're considering the $200,000, and we are saying that we want the average Ghanaian youth to be innovative, I think the next question is how many, like the youth in Ghana, how many of us can afford $200,000? And then, so if we just look at that, we know we cannot afford it. But then what measures are we putting in place? Are we teaching our youth how to write grants, how to acquire extra funds? I don't know if Mr. Bassin can help us.
Great question. How do you get the funds? I believe innovating and entrepreneurship are totally 2 different things. You can innovate and you can actually collaborate with somebody. Maybe you've thought of something and go talk to him and, partnership with him and make money. So you don't always have to fund it yourself. Do you guys want any comment to it, or I think that's good? But briefly, please.
Yes, I seriously agree with my sister because assessing fund or capital for investment is quite a challenge in Ghana, especially if you want to rely on our financial institutions where the interest rate is almost between 28 to 31%. How will you be able to pay for this money within a short-term period? period. So it's quite a challenge, but I like the idea of partnering or having a joint ventureship with a maybe existing institution to support your establishment. So joint ventureship or partnership is what I would recommend. Thank you.
Okay, let's take one more question, and then we can all go home. Oh, yes, the summary. Yes, sir.
Okay, so with regards to what you said about innovating and partnering with someone to get the funding, what if you speak to someone about your idea and a person goes behind you to go and put that idea into effect to make more money? There's nothing in place to safeguard your idea that you're discussing with the person. There's nothing protecting your intellectual rights in this case, because it's just a conversation you're having with me. Oh, help me do this. I have this idea. I want to do this. I need funds. Next thing you know, the person is on the news saying, I'm going to do this. Then he makes billions of money, and then you are just there in the slum somewhere, and then you're like, it was my idea.
You guys hear his question? What is to prevent somebody from stealing your idea? Now, in addition to being an immigration lawyer, in my previous life, I was an intellectual property lawyer, patents and trademarks, all that, great. But of course, you can have NDAs, non-disclosure agreements and all that. Frankly, that's a difficult issue to deal with. You may have to trust the person. So I'm not sure how to answer that.
All right. I think if you want to engage someone in that regard, what you need to do is to have an NDA signed, right? Have an NDA. Yes, you need to have it. If somebody walks into my maker space, you sign an NDA. If you want to do something, if I want to teach you something using my equipment, you sign an NDA, right? So let the person sign an NDA first. Then you begin the conversation. Yes, I want to discuss something with you, a business. But let's sign this one that says that, yes, everything that we will discuss, you hold it confidential. Let's have the NDA before we start, because it will be difficult getting an external person to trust. Even if it's your friend, you cannot do that. So have the NDA. Let's go through the process first. Sign the NDA before you open the discussion.
Sign an NDA? Oh, okay.
Let me ask, can I
would I add something? Then you go, okay?
So, as he indicated, it is very, very important that when you are going to join ventureship or partnership, you have an agreement signed. You have a lot of legal firms that, even in some companies, it is stated that if you work with me and you are leaving, you cannot work in a similar organization for 5 or 25 years. You can't work in a competitive company. So please make sure that you document your agreement and duly signed. Try as much as possible to have a lawyer or a legal firm to assist you in developing such an agreement.
NDAs with non-disclosure clauses are critical, but they're not enough. An NDA can be ignored, and you have to sue them. That costs you money. Getting things back costs you money. Everything is difficult. But if you don't disclose the key to what you're doing, and they can't figure it out easily, that's the ideal. Coca-Cola has, for 100 and something years, everybody tried to copy them. They keep the formula secret, and nobody can figure out what it is. And that's the way Coca-Cola made billions of dollars. And they partner with people all over the world to produce Coca-Cola, but they provide the syrup. So in terms of the cuff, you would have to be knowledgeable about what the material is that you're using, if it was material-based, and not give that out, and not allow other people to see what it is. Non-disclosure agreements with non-compete clauses are critical, but are not the total answer. You need to be more careful.
All right, we're going to wrap that up. Thank you so much to the panel. I still want to make those gloves, so if you're interested, come see me. Maybe we could partner and make some money. I believe in the gloves. Yes.
So I want to thank everybody who came today. I have learned a huge amount, but I want to just take 2 minutes at the end because everybody's anxious to leave. But I want to take 2 minutes at the end to remind us that we started with today the idea is that we're going to look for people who we can partner with. And I hope that you've met a few people today and learned about a few people today, learned about some things that we're going to be trying to do in the future, and found ways to think about making an impact, whether that means starting a company of your own, partnering with people to start a company, or giving your ideas on a company to someone who understands the entrepreneurship well enough to make a difference. As 4GBI, the organizers of this conference, we're really interested in getting your feedback. I want to just make sure you understand how you can give your ideas to us, what your thoughts are. Tell us what is the most important thing you learned today, or what idea was triggered by listening to what was going on today. 4gbi.org, and Sam will tell you just how to pass on that information.
Key is you can go onto the website, 4gbi.org, and go to the email us and just write your summary of your idea. If it's a comment, that's different. If you're just commenting on what you learned and so forth, that's different. But if you want to submit an idea, summarize it. You can attach things, but we won't look at everything because it's going to be like triage. We're going to be looking at 100 different ideas. Yeah, no, we're not going to look at all the attachments. People will put on. I know from experience. Anyway, so a summary is critical, and your name and contact information is critical. If you're submitting an idea, we will always need more information. Like I keep talking about finding out what you're getting into, we need to talk to you about why you think that's a good idea, what's involved with it. So put your contact information if you want this idea to be really followed through with. Thank you.
Thank you, Sam. Anyway, I want to thank all of you, but I also want to give Osabarima, who was critical in the organization of this entire week, a chance to just say a last word or two.
You know, as Dr. Sari mentioned earlier on, 4GBI consists of the United States, natural-born persons, and those of us that were born here that want to bring changes here. I mean, when I did the opening remarks, I mentioned about agents of change. We do appreciate Professor Markowski and his institution, Northeastern University, specifically the Biomedical Engineering Department. Sam Bird, who's a graduate from that institution, that also has come. It has been a very intensive week. And then lawyer Francis Ejare, my own brother and cousin, he did a fantastic job on facilitating the entrepreneurship and innovation. Give him a big hand of He's always the person that is always behind the scene. He doesn't like to be in front, but as you all can see, he should be in front more. Dr. Temesari, who is my sister, a friend and everything, and she's also will tell it to you like it's supposed to be said. She doesn't hide it. And if you can't stand the heat, get out of the kitchen. Professor Fred McBagley, I got it right, and I keep getting it right, whom are known for quite some time through Worcester Polytechnic Institute. As a matter of fact, those students will be coming here in January, so January I'll be back. But last but not least, Robert. I'll let you thank them. My sister, Nanekia, where are you? Bring your team to the front. You know, we did. Michael, yeah, come. So we did their workshop in Chebi on Tuesday. And we had significant numbers. I think we had about maybe 200 people that showed up. So this has generated enormous interest. And these were the people that were behind the scene. You know, the food that you've been eating, the reminders, the snacks, the drinks, your names, everything. They've done it all. They professionals themselves, midwife and nurses. My linguist, what's Kwesi? A driver. You know, you can't go from point A to B without these people. We don't know Accra. Most people, when people will ask me about Accra, I'm from Junase. I left Junase and went to London, US. So if you were to ask me, it was yesterday was the first time I've seen Kolibu. I'm serious. I mean, I'm not going to lie, you know. And so on behalf of for Ghana Biomedical Innovation, I thank these women and men for their enormous support and unconditional help in the interest of this project, which we are going to make sure that there will be a reasonable course of action after we leave and circle back. And I'm going to turn it to Dr. Sari. I know she can't wait to talk. So I did it.
You thanked everybody. Well, thank you. Oh, Robert, the team. Oh, but you thanked everybody. Yeah, thank you very much. But thank you guys for coming. We put 8:30 down, and I know some people, you know, coming from afar, even within Accra, the traffic. So we really appreciate you taking the time to come and join us and share your thoughts and ideas. Oh, yes. In appreciation, we have a little something to defray your cost. So please see our able assistants here before you go. So thank you so very much again.
Okay, so on behalf of the guests too, we also want to say a very big thank you to you all, our facilitators. We are so grateful. It's been very insightful, and I know we've all learned something. And I just want to repeat, like they said, their website again is 4gbi.org. So please go there, put down your comments, your ideas, which is the most important reason why they came. So it's very important to them. Let's not disappoint them. So if we could go online and then do that, that would be very appreciative. And then our registrar, Dr. Filibano, had to leave before we close. So he asked to say thank you so much for coming. He really appreciates you, and God bless you.